Members, please be seated.
Under orders of the day, special debate on the COVID-19 pandemic.
Honourable members, pursuant to Government Motion 100, which was agreed to on October 28, 2021, I will first call on the Honourable Premier, President of Executive Council and Minister of Intergovernmental Relations, to make a statement not exceeding 30 minutes. Then I will call on the Leader of the Official Opposition to make a statement not to exceed 15 minutes. Following those two statements, and for a period not to exceed 30 minutes, the Leader of the Official Opposition may pose questions on matters relevant to the Premier's statement or the government's response to the COVID-19 pandemic, and the Premier or any member of Executive Council may respond to those questions. I now call on the Honourable Premier, President of Executive Council and Minister of Intergovernmental Relations. The floor is yours.
Well, thank you very much, Mr. Speaker, and through you to all members for their presence and participation in this important debate on the state of COVID-19 in Alberta. Mr. Speaker, we all know that Alberta, like the world, has been hit hard by this devilish disease that has plagued our lives for some 20 months. Mr. Speaker, upending lives in every part of the world and taking many lives, millions of lives around the world. Mr. Speaker, like all of those other jurisdictions, like our fellow Canadians, we have done our best through trial and, yes, through error to keep people safe by protecting lives and livelihoods as our central goal in addressing the pandemic. Mr. Speaker, I'm often asked what Alberta's objectives have been in the COVID crisis, and very simply, our key goal has been this: to protect our healthcare system and prevent it from being overwhelmed, while seeking to minimize deaths as a result of this disease, and at the same time minimizing the damaging impact posed by public health restrictions. In other words, Mr. Speaker, Alberta has sought, admittedly imperfectly, to balance these different objectives of seeking to protect lives and livelihoods while avoiding the kind of large-scale and sustained hard lockdown policies that have led to profound negative health, social, and economic consequences in many parts of the world. Mr. Speaker, as of today, there are 689 Albertans hospitalized with COVID-19, 157 of whom are in intensive care. In addition, I'm pleased to report to the House that as of today, over 87% of eligible Albertans have received at least a first dose of a COVID-19 vaccine, and over 80%, now 80.3%, have been fully vaccinated. Tremendous progress on that front. New cases, total active cases, the positivity rate, the rate of transmission, and hospitalizations are at their lowest point since September the 10th. Mr. Speaker, this province was hit hard, as we know, by the fourth wave of COVID, but thanks to the diligence and care of Albertans, this province has risen to the challenge, and we can now say with a high degree of confidence that we have broken the fourth wave. Now, this does not mean, Mr. Speaker, that COVID does not continue to pose a threat, because indeed we continue to have the highest level of total ICU admissions in our hospitals in the history of our healthcare system since, with the exception of the beginning of the fourth wave. Mr. Speaker, we must continue to exercise great care and caution, but at the same time we should, I think, be grateful for Albertans coming together to respond strongly to this fourth wave, particularly those who have stepped up to get vaccinated. Because, Mr. Speaker, we went into this fourth wave largely as a result of Alberta being under-vaccinated. Together with our neighbours in Saskatchewan, we went into the month of September, at only 78% first dose vaccine coverage, about 10 points behind the national average at that point. Mr. Speaker, I have spoken publicly to the error that was made in terms of Alberta's analysis of the future of COVID-19 this summer. I think we were right to lift public health restrictions when we saw very low case numbers, very low rates of transmission, and very low hospitalization rates in the middle of this summer. We, however, clearly were wrong to project that we could move durably from a pandemic management to endemic management. That projection and plan was predicated on a careful analysis of the epidemiological patterns in similar jurisdictions with similar levels of vaccination, such as Israel and the United Kingdom, which had lifted all public health restrictions. And while in the case of Israel, they did see a significant case growth for particular reasons I could delineate, they did not see unmanageable pressure on their hospital system, and nor did the United Kingdom. But, Mr. Speaker, as Dr. Hinshaw has outlined, the modeling of our Chief Medical Officer and Department of Health in this respect failed fully to take into account the different coverage over age cohorts of the vaccination program. What we saw effectively in this fourth wave was it hitting middle-aged people who are under-vaccinated very hard in this province, whereas in the United Kingdom they had higher relative rates of vaccination, and in Israel, higher relative rates of vaccination in the 20 to 50-year-old age bracket. But, Mr. Speaker, we had a higher level of vaccination amongst 12 to 18-year-olds, 12 to 30-year-olds. And so, because older people are more susceptible to severe outcomes from this disease, we saw the manifestation of that in the higher rates of infection and hospitalization, severe outcomes both here and in Saskatchewan. Nevertheless, Mr. Speaker, Alberta today is 10.5% below the Canadian per capita COVID fatality rate, which is to say Canada as a whole and some other provinces, such as Quebec, have a higher, Quebec and Manitoba, have a higher fatality rate than Alberta on a per capita basis. I know that is no comfort to the families of some 3,000 people whose lives have been lost in this province to this disease since its onset in March of 2020, and we grieve for all of them. I know I speak for all members in expressing our sincere condolences to those families, just as we express condolences to those who have passed away from other diseases in that time. We should not forget about those, Mr. Speaker. COVID is not the only health challenge or the only tragedy. Mr. Speaker, Alberta is also below the per capita fatality rate of COVID-19 for 48 of the 50 United States and 26 of the 28 member states of the European Union. I think it's, while we mourn the loss of lives here, important to keep this context and perspective, Mr. Speaker, that while so many jurisdictions have been hit hard, Alberta has been hit less hard than many. Indeed, we have been hit less hard in terms of fatalities than most of the developed Western countries and jurisdictions, Mr. Speaker. And Alberta did manage to do that by taking a more balanced approach. According to the Centre for Excellence on the Canadian Federation, Alberta had the least stringent COVID-19 public health measures throughout the course of the pandemic, and that is something that's been, in fact, the Blavatnik think tank at Oxford University said that Alberta had less stringent COVID-19 restrictions than most EU countries and United States in 2020. And so, Mr. Speaker, that reflects an effort to have struck a balance, again, between lives and livelihoods, recognizing, as our Chief Medical Officer has frequently pointed out, that public health measures have their own damaging effects, and we must address multiple challenges to human health and the health of our broader society. Mr. Speaker, there was, having said that, severe pressure on our healthcare system at the height of this fourth wave, which is why the government implemented advice that we received from the Chief Medical Officer to introduce additional public health measures, central to which was the restriction exemption program, a proof of vaccination program for discretionary activities. But at the height of the pandemic, at the height of the fourth wave, Mr. Speaker, we we're experiencing total ICU admissions in our hospitals of over 300, which was about 190% above the total typical baseline ICU capacity of Alberta's 100 hospitals. And had we not taken action, Mr. Speaker, we ran the very real risk of running out of critical care capacity for not just COVID, but other patients in need of critical care. That's why action was so critical in September, and it's clear now that those actions were effective. Now let me pause, Mr. Speaker, to thank and commend Alberta's brilliant, professional, and courageous frontline healthcare workers who, again and again, wave after wave, after 20 months, like their compatriots all around the world, have risen to the challenge and performed sometimes heroic work to protect lives and to serve their patients. Mr. Speaker, I'm often asked, why is it that a province as wealthy and as large as Alberta, with 4.5 million people, a $360 billion economy, a $65 billion government budget, why a province with a $21 billion healthcare budget, with the second highest per capita health expenditures in Canada, would be so quickly and so readily under stress that we might be running out of ICU capacity at some point? Well, Mr. Speaker, that is a very good and important question. And I submit that when we can finally turn, please God, the page on COVID in the future, that we and other governments in Canada, people all across our society, all across the political spectrum, must have an honest conversation about why we encountered such significant limitations in such a well-funded and modern healthcare system. We have seen that while COVID numbers in the United States were typically much higher than here in Alberta and the rest of Canada, so too was their hospital capacity. Now, that's not an argument in any means, in any way, to replicate the American health system, which has fundamental flaws, Mr. Speaker, but it is a call to humility to learn from why. We have, in many cases, 1/3 as many hospital beds as U.S. states who have much smaller economies, Mr. Speaker, on a per capita basis. So we need to learn, and I've asked the Minister of Health, the Honourable Minister of Health, first of all, to help us to plan better for any potential future waves in terms of capacity, but also to plan for the longer-term challenge of a more flexible healthcare system. What we had to do in this instance, Mr. Speaker, like provinces across Canada that have faced similar waves, like Ontario, Quebec. Ontario, for example, in its third wave in the spring, faced higher per capita levels of ICU admissions than Alberta did in the fourth wave. Manitoba, in its third wave in the spring, faced much higher per capita levels of ICU admissions, such that they had to export patients. Ontario had reached out to us, Mr. Speaker, about potentially offering support from Alberta healthcare workers to their hospitals and taking potential overflow patients from them. The Interior and Northern British Columbia hospitals have faced a similar circumstance in the fourth wave, moving patients to the Lower Mainland. And of course, Quebec, with the highest death rate for COVID in Canada, has faced serious challenges as well. Saskatchewan right now is facing a higher per capita ICU admission rate than Alberta did at the peak of our fourth wave 3 or 4 weeks ago. And so this is not simply an Alberta challenge, Mr. Speaker. This is a Canadian challenge. We need to learn. Because, Mr. Speaker, all of these provinces, the only way that we managed to stave off a disaster of having to invoke critical care triage protocols, the only way we in Alberta managed to avoid having to transit patients out of province was by surging 200 additional ICU-capable beds, which required the postponement of approximately 50% of scheduled surgical procedures in Alberta. And those postponements, of course, each one of them creates anxiety, stress, and undoubtedly in some instances negative health outcomes. That is not an acceptable way to manage extraordinary pressure such as this. And so we must, within the second largest health budget in Canada, which is one of the biggest spenders on healthcare in the OECD for a publicly administered system, we must, Mr. Speaker, come up with a more flexible system where we can more readily transition healthcare capacity from surgical to critical care and back to surgical services. Ultimately, the limitations that we discovered, that we have experienced, I should say, were a reflection of the scarcity of people with relevant training, Mr. Speaker. So a scarcity that has been experienced all around the world. I saw an article in the Wall Street Journal 2 weeks ago about the global shortage in certain health trades. One thing that critics of public health measures here have not perhaps fully appreciated, Mr. Speaker, is that when it comes to critical care, we would typically only have about 850 registered nurses with ICU experience and certification to support roughly 175 ICU baseline beds. While we have sought from the beginning, Mr. Speaker, to accelerate training, truncated training programs for new ICU nurses, at the end of the day, we have at the same time faced attrition as people of a certain generation have been retiring and many others have been under extreme stress, unable to take extra shifts. And so, Mr. Speaker, again, this is a challenge very similar to what's being faced in other provinces. I do want to appreciate some support that we received from outside the province at the height of the fourth wave, Mr. Speaker, with a team of medical staff from Newfoundland and Labrador. The Premier there reached out to me very thoughtfully at the beginning of September and said that Alberta had been such a huge help to Newfoundland during its challenging times, and they wanted to offer at least some gesture of support. And so we very much appreciate those medical staff who were located at the Fort McMurray at the Wood Buffalo Regional Hospital. In addition, Mr. Speaker, we were happy to receive support from a team from the Canadian Armed Forces that consisted, I believe, of 8 nurses, 1 senior critical care nurse, and 6 staff nurses. And thanks to them, we were able to support 1 to 2 additional ICU beds out of the 380 surge beds that were available. And indeed, the Canadian Red Cross provided, I think, 18 staff that were of general nursing capabilities to support the Red Deer Hospital in central Alberta. And indeed, Mr. Speaker, we are all in this together. Just as Alberta shipped planes full of ventilators and surplus personal protective equipment to our fellow provinces in the first wave of the pandemic, we have also received significant numbers of patients from other provinces. Alberta has, Mr. Speaker, Alberta, since March of this year, Alberta has accepted a total of 440 COVID and non-COVID patients from other provinces. This included 35 ICU COVID patients and 99 non-ICU COVID patients. Tonight, I believe we have 5 or 6 out-of-province ICU patients in our hospitals. So while we do appreciate support from the rest of Canada, at the same time, we should acknowledge that we've been there continually, even in dire circumstances, to support the rest of the country. We've been helpful for patients. Of course, we are the backup hospital system for the Northwest Territory that was hit with a harder fourth wave in terms of per capita infections. We've been a backup hospital for the border regions of British Columbia and parts of northern British Columbia, and we've been very helpful to our friends in Saskatchewan as well when they've needed that assistance. I should also point out that we're all in this together, just as I think every province, British Columbia, Saskatchewan, Manitoba, Ontario, Quebec, Nova Scotia, those provinces, in addition to Alberta, at some point have benefited from Canadian Armed Forces support during the history of COVID in Canada, Mr. Speaker. And so let me turn then to the future because, Mr. Speaker, as we see, thanks to the diligence of Albertans, the fourth wave coming under control, and in that respect, I think we can now say definitively and gratefully, Mr. Speaker, that we have not witnessed the potential Thanksgiving bubble, Thanksgiving spike in cases that we were concerned of. As you know, the second wave in the fall of last year, Mr. Speaker, resulted in, well, it seems to have been triggered in part by indoor social gatherings around the time of Thanksgiving, and then later in October, Halloween. We can clearly correlate the second wave to those indoor social gatherings. But we called on Albertans to be vigilant at this Thanksgiving, to limit social interaction, and they rose to that call. And so what we have seen is a continued decline in transmission, new cases, active cases, positivity rate, and rate of transmission since Thanksgiving nearly a month ago, three and a half weeks ago. Indeed, over this past weekend, Mr. Speaker, we on the 29th of October saw a positivity rate testing positivity rate is now 5.1%. So it's continued, thankfully, to decline. But, Mr. Speaker, I think the most important factor in getting the fourth wave under control, and the single most important tool that we have to prevent potential future waves that could impose unbearable pressure on our hospitals, is the miracle of modern medicine of vaccines. As I said at the outset, the fourth wave here was largely, and in Saskatchewan, where we've experienced very similar numbers and pressures, was not coincidentally attributable to the fact that our two provinces had identical vaccination rates at 77-78% at the beginning of September. On September 3rd, Mr. Speaker, Alberta's government introduced the $100 incentive to reach out to people who had not yet been vaccinated. Our public opinion research from the beginning has suggested that about 7 to 9% of the population are determined not to be vaccinated, but that perhaps 92%, give or take, of the adult population is either intends to be vaccinated or open to vaccination. And Mr. Speaker, we needed, in our view, to use every tool at our disposal to reach people who have different motivations and different interests. And we do know that after the introduction of the $100 incentive, we saw a measurable increase in first dose bookings and demand. Then, Mr. Speaker, following the September 14th introduction of the restriction exemption program, we saw a very significant increase, further increase in vaccine demand. In fact, between September 3rd and now, the end of October, we have seen vaccination rates for first dose coverage amongst the eligible population move from 77 to, as I mentioned, 87.1% today. So that is very substantial progress. That represents, Mr. Speaker, about 320,000 Albertans who have stepped up for their first dose, and the gap between first and second dose coverage is closing. This is so critically important because, Mr. Speaker, the vaccines in Alberta have proven to be, I mean, around the world, but in particular in Alberta, the data is astonishing about the powerful protection that these vaccines offer. Yes, from infection and the ability, therefore, to transmit, but also, and most particularly, from severe outcomes. Mr. Speaker, consistently, since the last several months, 90% of our ICU patients with COVID have been unvaccinated. Now, sometimes the people who are confused about vaccines say, aha, but what about the 10% that are vaccinated? Well, Mr. Speaker, those are typically very elderly people with multiple severe health conditions who are the unvaccinated who get severe symptoms. But, Mr. Speaker, that 10% represents now 85% of the population. So I think we did the math on this, Mr. Speaker. If you're in your 50s, between 50 and 60 years of age, you are 56 times more likely to be hospitalized with COVID than if you are unvaccinated than if you're vaccinated. 56 times more likely to be hospitalized if you're an unvaccinated 50-something than if you're a vaccinated 50-something. So, yes, breakthrough infections are possible and they happen, but they are relatively rare. And breakthrough hospitalizations for vaccinated individuals are a tiny fraction of hospitalizations and deaths for people who are unvaccinated. So the most important thing we can continue to do is to continue pushing those vaccine numbers higher and higher. Now, we're probably getting to a point of diminishing returns. We would estimate that now at 87% first dose coverage, that maybe at the outside, based on our research, we could pick up another 5 percentage points of the eligible population, and it will probably be slower going now, Mr. Speaker. We are launching, as we speak, yet another information campaign to address fallacies and myths about vaccine safety and efficacy. In fact, starting tomorrow, a mailer will be arriving at every household in Alberta, a very substantial presentation of the hard facts so that people can make their own decisions. Of course, what we encourage them to do is to talk to their own medical practitioners, Mr. Speaker. And in that respect, AHS reports per their worker vaccine mandate that some 96%, I believe, of full-time AHS staff and doctors with visiting privileges have confirmed their vaccination status. We believe a significant number of the remaining 4% simply haven't got around to filling out the paperwork. So that would, from that, we could infer that Mr. Speaker, nearly 100% of Alberta physicians believe in the safety and the efficacy of the vaccines in terms of their own personal healthcare choices. Mr. Speaker, I've got 5 minutes just to say that in the midst of this serious public health crisis, of course, we have also been coping with the twin crisis, especially last year, of the global COVID economic collapse, the worst since the Great Depression, and the energy price collapse of last year, the worst in history, which really challenged this province doubly hard, Mr. Speaker, because we, unlike any other, we were hit harder than virtually any other jurisdiction in the developed world because of the concomitant collapse in energy prices, going from $64 WTI at the end of February of last year to minus $40 for a period. But, Mr. Speaker, I am pleased to report that Albertans have demonstrated yet again their incredible resolve and resilience, their entrepreneurial culture. And we see that in a tremendous economic turnaround story emerging from the COVID economic crisis. Indeed, Alberta, we have, in our most recent Treasury Board and Finance quarterly update, upgraded Alberta's growth projections this year based on our own and private sector forecasting from 4.4% to 6.7%. There is no doubt that Alberta is leading Canada in economic growth this year. Most economists project that we will do so again next year. Since the beginning of July, from July to the end of September, Statistics Canada reported in its labour force survey the creation of nearly 60,000 net new jobs in this province, some 90,000 net new jobs since the beginning of 2021. And so we have effectively seen all of the jobs lost during the COVID crisis last year replaced in our labour market as more people come back looking for work and as more and more employers report labour shortages as their primary current challenge. Mr. Speaker, the great part of this good news is that it is not simply a reflection of stronger commodity prices. While that is helpful, it has not actually translated into any meaningful increase in capital spending or hiring in the energy sector, which is still repairing balance sheets from the catastrophic damage of last year's price collapse. But, Mr. Speaker, what we are seeing is, I think, an historic acceleration of the diversification of Alberta's economy, right across the economy. We have been experiencing, we're in our second year of record best years for the Alberta forestry industry. Last year was the second best year on record for Alberta agriculture. This year, bad weather, but still hundreds of millions of dollars of new investment in agri-tech and food processing. We are experiencing, by orders of magnitude, the best year ever in our film and television industry. Since launching the expanded Alberta Film and Television Tax Credit, we have seen the investments reach $1 billion this year as studio space is being created, tripled, quadrupled in capacity Crews are flying here from other parts of Canada as that creative industry takes off. The best year ever, by orders of magnitude, in venture capital investment, which is the jet fuel of tech startups in the digital industry. The best year ever in the digital information technology industries, with global giants like Infosys and Emphasis coming here, but also Rogers and RBC announcing major centers of excellence with hundreds of new staff in Alberta. In the next couple of weeks, we are going to hear a historic investment from a major global company about I think, the single most important game-changing investment in the tech sector in Alberta history. Air Products announced their $1 billion investment in the world's first net zero hydrogen project here in Alberta, and they've said they will likely triple that, and that was thanks to the determination of this government, Mr. Speaker. And I can tell you we are looking at billions more in investments to make Alberta a world leader in the future multi-trillion-dollar hydrogen economy. We have, Mr. Speaker, just 2 weeks ago announced the historic Dow investment, the largest investment in Alberta in at least a decade. I could go on. Let me just wrap up by saying, Mr. Speaker, we still have very real challenges ahead of us, but, Mr. Speaker, the future looks bright.
Thank you, Honourable Premier. I will now cede the floor to the Honourable Leader of the Official Opposition for a statement not to exceed 15 minutes, after which we will get into some question, the first of the question period, sections of which I will have more to say at that time. The Opposition, Leader of the Official Opposition, please.
Well, thank you very much, Mr. Speaker. This fourth wave, which is the actual subject of our discussion tonight, is a tragedy, made all the more so, Mr. Speaker, by the fact that it was entirely and utterly preventable. This UCP government simply refuses to learn from its mistakes, and the fact that we had the worst outcome in this province on the fourth wave is clear indication of that fact. Now, in the first wave, we know that Alberta, like most provinces, all provinces, in fact, across the country, had what we didn't know at the time was relatively low numbers of infections and tragic losses as a result. But even in that situation, we managed to distinguish ourselves as the country, or as the province, that had the worst workplace outbreak in North America with respect to our profound mishandling of Cargill and JBS and the infections that took off there. In the second wave, we had deaths in long-term care, and we had a premier who went missing for 12 days in the middle of the height of that pandemic. And then ultimately we had the beginning of what became a trend, acting least, the latest, such that we ended up having to entirely cancel Christmas for all Albertans except for members of the UCP caucus. And then we had the third wave, another uncontrolled spread, the highest cases in Canada, reimposed restrictions even as members of this cabinet were seen enjoying scotch on the Sky Palace in breach of the rules. And then we had the fourth wave. At its height in late September, Alberta was reporting more than 1,500 cases per day and 24 deaths per day, more than 20,000 active cases, the most in Canada. There are lessons that this UCP government must learn on how to stop the spread and how to save lives while supporting businesses, supporting families, supporting children in school. But in order to learn those lessons, we must actually have either a public inquiry or an all-party inquiry. You know, in Walkerton, where 2,000 people got sick and 6 people died, there was an inquiry. This is much worse. So while it is great to be able to be here to debate and engage in rhetoric, I don't believe that we are getting anywhere close to the level of accountability that the people of this province are owed by the members of that UCP government. Nonetheless, how did we get here? Well, quite honestly, I think when we're talking about the fourth wave, it didn't begin with public health. It actually began with the Premier's poll numbers. He was in political trouble, and somebody over there got the idea that if they could just say best summer ever and make a bunch of hats with that on it, that somehow maybe there was hope that they could recover. So he ignored the warnings. He called public health experts and doctors fearmongers. He accused them of spreading fear porn. He accused the opposition of making up a fourth wave. Yet to get the apology on that one. He drove ahead with a reopening plan based on modeling that he claimed he didn't have and later claimed, and again even tonight claimed, didn't work. Based solely on UK data, making faulty assumptions. He claimed 70% first dose was good enough, but Theresa Tam had already said we needed 75% of 2 doses before we let go everything else. By Canada, we were at 42%, but away we went, lifted all the restrictions. He and his staff told Albertans the pandemic was over, that we were moving into the endemic. They announced plans to stop testing, stop contact tracing, stop isolation protocols. Albertans had to protest, Mr. Speaker, just to get those extended. By August, it was clear the plan was failing as active cases were climbing more than 3,000 by August 10th. And what did the Premier do? Well, he went on vacation, and we have no idea who was watching the store while he was gone. And after he left, everyone else either started calling for or implementing the very measure that the Premier now admits is working, which is vaccine passports. What did these folks do? They started fundraising against them. New cases passed 800 per day, and at the end of August, AHS started canceling surgeries. The Premier returned on September 3rd, announced his $100 plan. Let's be clear, you would need a nano microscope to measure the impact that that had. And then he waited 2 more weeks in order to actually announce passports. So that's the summary, in short, of what happened. But meanwhile, what were the consequences? And this is really important, Mr. Speaker. This lack of leadership caused a fundamental collapse to Alberta's healthcare system. And I'm actually quite shocked and troubled to hear the Premier beginning to position into the mode of actually trying to blame our public healthcare system for the mistakes that he and his cabinet colleagues and his caucus colleagues made. Shameful. 8,500 surgeries canceled at least. ICUs overwhelmed. Frontline workers so exhausted that, as the Premier mentioned, we had to call in people from other provinces. We also saw more economic hardship. Businesses had to react to vaccine passports with almost no notice because they were told over and over and over again that they would never happen. I don't know why. But they got very little notice and no support to do it. Meanwhile, we've got the other so-called business supports, the SMERG payments, Jobs Now. None of that stuff is happening. It's now jobs TBD. Not exactly what people in this province need in terms of support, small business owners need in terms of support from their government. We had chaos in schools, parents deeply stressed, teachers deeply stressed, outbreaks all around the province, and children who are suffering from unprecedented levels of mental health issues. And I know this because I hear people come to me on the street and talk to me about this day in and day out. And it caused pain and suffering. Albertans whose supposed elective surgeries were canceled, and by elective I mean somebody with a brain tumor who now has to wait, somebody with cancer who has to have their radiation and their chemo rescheduled, somebody waiting for organ transplants who had to have them put off, children who needed critical surgery that were absolutely fundamental to their actual development over the rest of their life, delayed. All that happened. 30,000 more Albertans got sick. More than 700 passed away. And each of those people have families and loved ones who should never have had to deal with it. Now, this Premier likes to roll out a lot of excuses, and I don't have time actually to go through all of them. But let's start with other jurisdictions all experienced a fourth wave. That's what the Premier likes to say. Let's be clear. Ontario, led by a Conservative Premier, nonpartisan observation here, learned from their lessons, established a science panel. It wasn't perfect, but they learned some lessons. And what happened? Well, Ontario during the fourth wave experienced 1/6 the number of new cases per capita. They experienced 1/5 the number of fatalities per capita. That's the difference. 5 times more people died here. 6 times more people got infected here on a per capita basis. So don't tell us that this happened in other provinces and we should just be okay with it. It was worse here because of bad decisions made by this UCP leadership. They say we did everything we could to push vaccines. And by that, I mean push vaccines as a means to fundraise around and to promise to Albertans and to create a wedge issue and say, we will never have vaccine passports and we will never use the word. And then we'll fundraise against it. Congratulations. Problem is, that is the thing that actually got our vaccination rates moving again. And we delayed a month after the rest of the country. The Premier himself acknowledged that once he announced we were open for summer, on June 18th, Alberta's vaccination rate moved 3 points between June 18th and the middle of August. Why do you think that is? Who is to blame for that? He'd like to blame Albertans. I would argue that he delivered a message that he should never have delivered. And then he failed to act on the thing that would have moved the dial for far too long. And then the other argument he likes to make, the only other alternative, what the NDP is calling for, what the Chicken Littles are calling for, what all the fear porn mongers are calling for, is a hard lockdown. And let me tell you, Mr. Speaker, that is so disrespectful. It is disrespectful to the people of this province who were concerned, who were scared, who wanted to see their government show leadership. That was never what we were proposing. That was a false choice, another false choice, another demonstration of empty rhetoric by a premier and a leadership that did not have the strength to make the choices that were necessary to protect the public health of Albertans. Because that was never what we were proposing. We were simply proposing that Alberta act with the same balance and measure that every other province other than Saskatchewan in this country acted with. And yes, we are similar to Saskatchewan, and there's a reason for that, because they followed the same bad advice that this premier was peddling. Other than that, we could have done so much better. 1/5 the fatalities, 1/6 the number of cases. That's what we could have done. Ultimately, this is not just about this premier, though. Everyone wants to make it about this premier. But this whole cabinet, this whole government is complicit. It was clear for weeks that the open for summer plan was failing, that the so-called decoupling theory was decoupled, and that hospitalizations were going up and Albertans were getting dangerously ill, and nobody did anything. Nobody said anything. The premier left the country for 2 or 3 weeks. We have no idea who was in charge while he was gone, and nobody said a word. Nobody stood up over there on behalf of their constituents, on behalf of frontline healthcare workers in their riding, who desperately needed somebody to stand up for them. Nobody did. So it's not just the premier's problem. It is the whole cabinet's problem. But now, as the premier rightly said, we do have to move forward. And there are a series of very, very important things that need to happen in order to protect Albertans. Because, we've been through 4 waves. I hope to goodness we're not all going to go wipe our hands of it and say, okay, well, that's COVID. Bye-bye. I hope by now we've learned that we need to be on our guard. We need to be measured. We need to dispense with decision-based evidence-making. And we need instead to start coming up with a plan to protect the health of Albertans. We need a science table, an independent science table, to restore public trust that has been desperately lost and sadly lost as a result of the actions taken by this government over the summer. We need an aggressive plan, a thoughtful plan to get vaccines into our schools so children from 5 to 12 can get access to them quickly. We need to have a plan to get boosters out there. We need a plan to go to those rural communities that still have vaccination too low, and we need to get those folks vaccinated too. We need to support our frontline healthcare workers and the healthcare system. Let's not demonize them. Let's not threaten to come and go after them for the mistakes they made. Seriously? Oh, wow. Let us instead think about how we address the point the Premier actually correctly raised. We don't have enough well-trained nurses. We don't have enough frontline healthcare staff. We need to treat them with respect. We need to recruit them into this line of work, something that will not happen under this government's record of constant, unfailing demonization and attacks, claiming that they earn too much money. And then when things get tough, we cancel their vacation, not the Premier's vacation, but their vacation is canceled. And their overtime is mandated. And they are forced to work when they are desperately tired and exhausted, and they still are. And we need to acknowledge that, and we need to find a way to support them right now. And we need a plan. We need a plan to figure out how we're going to catch up with those surgeries. And we need more than the vague generalizations we've been getting from the health minister. We need numbers and metrics so we can track them and keep this government accountable. We need to support our schools, as we've been begging this government to do since the beginning of this pandemic, and they have failed to do at every turn. We need contact tracing, we need safe classrooms. And this government needs to finally get money out the door to small business owners who are desperate for it. The SMERG, the jobs to BD, all these things, they need to be done, not talked about, but delivered, and they haven't been, and I look forward to further conversation throughout the remainder of our time.
Thank you. Honourable members, for a period not to exceed 30 minutes, the Leader of the Official Opposition may now pose questions relevant to the Premier's statement or the government's response to the COVID-19 pandemic. Order. Order. The Honourable Premier or any other member of Executive Council may respond to those questions. Neither the questions nor the responses may exceed 2 minutes at a time. I will now call the Honourable Leader of the Official Opposition.
Well, thank you very much, Mr. Speaker. This is a new format, so I'm going to try to get some good questions in there and hopefully get some good answers. And I want to talk a little bit about modelling back in June, and we'll start there. Now, the Premier told us that he relied on modelling for his open for summer decision. On June 16th, he rose in this House and he told us he didn't have any modelling. 2 days later, he went out and had a press conference and announced that July 1st was the day that we would have Freedom Day. So my question is this, as a starting point: did he receive that modelling that he claimed he didn't have on June 16th, on June 17th, and make a decision on the basis of 1 day's worth of modelling and reviewing it? Or conversely, did he make the open for summer announcement on June 18th without the benefit of modelling? This is an important question because it is absolutely critical to get an understanding of exactly what happened when. And what we're told by this Premier is that we did not have modelling 2 days before he announced that we would be going ahead to open up on July 1st. So can the Premier please answer that question?
I see the Honourable Premier has risen.
Yeah, Mr. Speaker, just for clarification, I have how much time?
2 minutes for questions, 2 minutes for responses as the max.
Thank the Honourable Leader of the Opposition for the question. Mr. Speaker, I don't recall a modelling presentation at that time. The Open for Summer plan was predicated on advice provided to a Cabinet from the Chief Medical Officer of Health to remove public health restrictions broadly once 2 weeks after the province had received 70% first dose coverage of the eligible population for vaccination and 55%, I believe it was, second dose coverage for vaccination. So those were the key thresholds articulated earlier in the month, in late May or early June, based on the Chief Medical Officer's analysis of the outcomes in similar jurisdictions with similar rates of vaccination. So that was the key predicate, that was the key input into the policy decision. And I would point out further, Mr. Speaker, that we did not see we did not see an increase in cases or hospitalizations following the reduction of public health measures. In fact, when they were lifted, most of those measures were lifted on July the 1st, we continued to see 4 or 5 weeks of declining and low case numbers, Mr. Speaker. There was not a correlation between those measures and the increase that we later saw. Now, Mr. Speaker, fundamentally what I think the member opposite is discounting is as I've mentioned, that there was a flaw in the analysis for which we take responsibility in not seeing that the United Kingdom had higher rates of vaccination amongst older people, particularly in the 30 to 50-year-old age bracket. That was an analytical error for which I apologize.
Thank you. The Honourable Opposition House Leader of the Official Opposition.
Well, thank you. So just to be clear then, I think I got from the Premier that in fact the decision was made without actually getting the modelling or actually asking for it before making the decision, which I find striking. That you would decide to go against what was happening in the rest of the country, forge your own path, be the first, and not actually ask to see the modelling. That is shocking to me. But nonetheless, you didn't ask to see the modelling, but you knew it was based on UK numbers. On June 14th, the UK itself delayed their own reopening strategy. So 4 days before you announced yours would open, based on recommendations of the CMOH, based on modelling that was based off of the UK experience, and the UK actually announced that they were slowing down their reopening strategy because it wasn't working the way they thought it would. So in addition, in and around that time, Israel, Netherlands, South Korea also backtracked. Did your cabinet not see that information? Did your health minister not go through that information? I've been in cabinet, Mr. Speaker. I have been in cabinet. I know what a thorough consideration of these kinds of issues look like. Yep. I remember the member for Calgary Mountain View questioning these things up the yin-yang. Nobody could question these things like the member for Calgary Mountain View, for example. I assume there are other members in that cabinet that would have questioned too. Are you suggesting that not a single one of them asked any of these questions? They were happy to go without the modelling, without seeing it. They were happy to not look at what was going on in other jurisdictions. They were happy to ignore that. Are you suggesting that they all just said, yeah, sure, no, sounds good, let's forge ahead. We don't need to see the modelling. Is that what happened in your cabinet when you decided to make the announcement that you did on June 18th?
I see the Honourable Premier has risen to respond.
Well, the answer is no, Mr. Speaker. At every time we have reached important inflection points in COVID policy decisions, I can assure the Honourable Leader of the Opposition there have been extensive, detailed, exhaustive discussions, requests for information, and a sharing of views, including interjurisdictional, cross-jurisdictional analyses, I should say. Mr. Speaker, the United Kingdom at that time had, in the month of June, much higher relative case numbers, hospitalization numbers than Alberta. But, Mr. Speaker, I would point out many other jurisdictions around the world, in Europe and in the United States, many U.S. states, states that were hit hard later in the fourth wave, in the spring and summer, saw a significant abatement of cases at vaccination rates lower than what Alberta was experiencing. You know, the state of Texas comes to mind, for example, Mr. Speaker, that eliminated all public health measures in mid-March and saw a collapse in cases and hospitalizations. So I think perhaps one challenge that the Leader of the Opposition has is she imagines COVID is kind of a common experience in every jurisdiction across the world, regardless of the many complex factors that feed into this. Climate, conditions, age structure of the population, the willingness of the population to comply with public health measures, and so many other conditions that feed into this. She mentioned Denmark, Mr. Speaker, which a month ago completely lifted all public health measures and has continued to see durable low cases. Mr. Speaker, as I've said before, and I know the Leader of the Opposition doesn't want to accept this, but every government has been trying to navigate its way through this through a process of trial and error. And many of the jurisdictions to which she has just referred have completely lifted public health measures following the direction that Alberta was headed in the summer, including the UK, Mr. Speaker.
The Honourable Leader of the Official Opposition.
Well, thank you to the Premier for explaining to me all the things I don't know. Here's what I do know. I know what the Premier himself based his decisions on. And you know how I know it? Because that's what he told Albertans over and over again. And he said it was based on UK modelling. And not UK modelling now. Please don't confuse the conversation. Let's go back to what was in front of you right before you made the announcement on June 18th to forge ahead and open up all the restrictions conveniently in time for your Stampede breakfast. Let us look at that. You talked to us, you talked to Albertans about UK modelling. And what I am telling you is that that UK modelling was flawed and that on June 14th, the UK was now stepping back. Yet, nobody in your cabinet asked to see the modelling that the CMOH apparently based her decision on. No one asked what was going on in other jurisdictions, and off you went. Now, you talked about vaccination rates. Let's talk about that. On June 25th, 6 days before your Freedom Day, Dr. Tam came out and said, you know what, this Delta thing is really worrying us. It's worrying us a lot. And now we think we cannot move ahead to all holds barred opening until we get to 75% first dose and second dose. Did the Premier stop and think? Did he question? Did he wonder whether that was the right thing to do? No. We went ahead on July 1st with 70% first vaccination and 42% second vaccination. On what planet did the Premier think that without the benefit of modelling, somehow he knew better than Canada's public health officer in order to forge ahead and create what turned into Alberta's fourth wave?
Excellent.
I see the Honourable Premier.
To be honest, Mr. Speaker, I have no idea what the Leader of the Opposition is carrying on about. I've never claimed to have access to the United Kingdom's modelling. I do know that our Chief Medical Officer of Health provided her advice broadly to lift Alberta public health measures in the summer when cases were extremely low, hospitalizations were below 100, our positivity rate, our rate of transmission, all of these things had been stable and low for several weeks. She also based it on an analysis of the impact of a similar rate of vaccination in the UK and in other jurisdictions. I don't have access to those countries' models. What I do know, Mr. Speaker, is, I have to point out another thing. That the Leader of the Opposition said Alberta was the only province to lift public health measures. It's simply not true. Saskatchewan and British Columbia did broadly the same, and most other jurisdictions did as well. Some maintained capacity limits for large events, and that's about it. But most of Canada was broadly open. And Mr. Speaker, is the member really suggesting that we should have maintained stringent public health measures in place in a province where we had extremely low levels of transmission, low positivity rate, very low active cases, very low daily cases, and very low hospitalization rates? On what basis would she have restricted people's fundamental rights, liberties, and their lives, Mr. Speaker? On no defensible basis. And as I pointed out, for several weeks after those measures were lifted, at the beginning of July, we saw cases continue to decline. I believe that Alberta Health has only been able to identify roughly 100 cases traceable to transmission or presence at the Calgary Stampede. Why does she keep focusing on the Stampede? The Leader of the Opposition attended events at the Stampede and other events around the province this past summer. And you know what? She was right to do so. Mr. Speaker, the critical thing is that we adjust as circumstances have changed, just as this government did following the emergence of this wave.
The Leader of the Opposition.
Well, thank you. Well, first of all, Mr. Speaker, the rest of the country did not open the way Alberta did. They took a more measured approach. Once again, the Premier is trying to create this false choice between hard lockdown and party down. And that's not actually what the options were, as evidenced by what BC did, as evidenced by what Ontario did, as evidenced by what Quebec did and most of the Maritimes and all the other places. Just Saskatchewan followed in his footsteps, and it's working out really well for them. But let's talk about what our CMOH had to say. The Premier claims, 5 weeks after July 1st, everything was looking super good. Well, on September 13th, when Dr. Hinshaw was not in front of the media, she said, and I quote, "Within a couple of weeks of July 1st, we weren't seeing the decoupling we expected." Within a couple of weeks. That's what she said behind closed doors, talking to other physicians. So the Premier is now saying, it all looked good for 5 weeks. That is not what Dr. Hinshaw told physicians. She could tell it wasn't looking good. So the question is, the Premier keeps saying, we had to take a light touch and we had to adjust. But we didn't see any adjustments. In fact, 2 weeks after July 1st, he was still accusing people of fear-mongering. He was still calling people names. He was still demonizing people who were raising concerns. So it's just a simple question, Premier. If Dr. Hinshaw said that she could tell that the decoupling that they had premised, the decision to open completely on July 1st was not happening, and there were concerns, why didn't the Premier act? And more importantly, why didn't anybody else in the UCP caucus act? Were they told, or was it hidden from them?
The Premier.
Well, once again, Mr. Speaker, throughout the month of July and into August, Alberta continued to experience very low and stable numbers in terms of new cases, positivity rate, rate of transmission, hospitalizations, and all of these key metrics, both leading and lagging indicators. I think it would have been indefensible to have maintained widespread restrictions on on personal liberties and on the society in those circumstances, Mr. Speaker. And I will once again point out that we had seen many jurisdictions with substantially lower levels of vaccination much earlier last year, lived all public health measures, and continue to see numbers decline for quite some time. So, Mr. Speaker, at this point, we must, I think, take greater confidence in the much higher levels of vaccination in Alberta. Today, surpassing 87% first dose coverage of the eligible population, surpassing 80% full vaccination amongst the eligible population. And we also know that, of course, a larger number of Albertans now have some degree of an immune response from prior infection. We need to continue to be careful, and we are likely to maintain many of the current measures in place through the balance of the winter as we are headed into cold weather season. And we may also be experiencing a waning effect of both immunity through prior infection as well as protection from vaccines, which has been experienced in some other jurisdictions. So our focus now is on ensuring that we take the right steps with prudence and caution as we move forward. But, Mr. Speaker, there are increasingly positive signs in many jurisdictions around the world that we are following as well.
Leader of the Opposition.
Well, that didn't answer really any of the question that I just asked, but nonetheless. So on July 28th, the CMOH announced that test, trace, and isolate was going to end. And as usual, when people were shocked and upset and concerned, because they all were, the Premier took to Twitter to say, quote, "It's time for the media to stop promoting fear when it comes to COVID-19, and it's time to start actually looking at where we're at with such huge vaccine protection." You know who else used to use that word? But nonetheless, by the Premier's own admission, between June 18th and the third week of August, vaccination rates had basically stalled. People were not getting more vaccinated. We didn't even get to the first target. We didn't, and we were nowhere close to what Dr. Tam had recommended. So my question, first of all, is why did the Premier not take that opportunity to say, but our vaccination rates aren't going up? And in fact, vaccination is a problem. Why instead did he say, our vaccination's huge? Why did he say that? He knew it wasn't happening. And my second question is this. A couple of days later, 2 or 3 days later, we know that the Ministry of Health was provided with modeling from independent modelers from other provinces that said, you know what? Your data is wrong. Your modeling is flawed. You are heading for a problem. Oh my Lord, please stop. Please listen to us. Here's why your data is wrong. The UK is not the right place to emulate. You need data from the US. If you follow that, you are headed for big trouble. Please stop. Please rethink. That was in the first week of August. Why didn't you act then? You had the information. Why didn't you stand up to protect Albertans then?
Honourable Premier.
Mr. Speaker, I think there were several questions there. First of all, with respect to vaccination, at that point, at 70% first dose coverage, Alberta and much of Canada were well ahead of the rest of the world. And so it's certainly in relative to, 70%, we've never received that, I think, ever in a vaccine program in our history, certainly not in 4 or 5 months. So certainly by historical standards and relative international cross-jurisdictional standards, it was an extremely high number. Mr. Speaker, thankfully we've continued to add to that now to 87.1% first dose coverage as of today. And in terms of the second question, I can assure the Leader of the Opposition that Alberta's Chief Medical Officer of Health has been in constant communication with her peers across the country, taking on board their advice and their views, and sharing those when relevant with the Emergency Management Committee of Cabinet. Once again, Mr. Speaker, the vaccination rates, we have, I think, had a particular challenge here in certain more remote communities. We have fortunately begun to see those rates move up significantly. In many rural areas, we've seen about 15 to 20 points in additional vaccination over the past 6 or 7 weeks. So I'm very gratified to see that, Mr. Speaker. And as I said, we'll be, as of tomorrow, exhaustive public health information will be arriving at the doors and mailboxes of Albertans across the province to help reach out to the remaining 13% who have not yet received a first dose.
Leader of the Opposition, and for the benefit of the Assembly, there is 10 minutes remaining in this block of questioning.
Well, thank you very much, Mr. Speaker. So let's go back then to the CMOH and what she was doing. So what I said, we didn't get an answer there. What I said is we know that independent modelers from other provinces had reached out to Ministry of Health and to the CMOH in the first week of August to point out what the Premier subsequently relied on as one of his excuses in mid-September, why their modeling wasn't working and that there was a problem. But nobody did anything. Now, when she was having her conversation with doctors in early September, Dr. Hinshaw also stated, quote, by kind of mid to late August, we realized we had a significant problem. So, my question now, CMOH, mid-August, knows we have a significant problem. Maybe it's because she's read the modeling even though nobody's acting on it. Why was there no action then? Did she recommend action, Premier? Did she recommend action to the health minister? Why was there no action? Why did you go on vacation then instead? Why was nobody left in charge when you were away, probably on a different continent? Why, when Dr. Hinshaw herself admits that by mid-August she knew there was a significant problem, why did everybody go dark? Why did you leave, Premier? And why weren't there decisions taken then to protect the health and safety of Albertans?
Premier.
Mr. Speaker, in point of fact, action was taken. The Honourable Leader of the Opposition will recall that the Chief Medical Officer announced a series of measures. I forget the precise date, but at the end of July, I believe, to formally move Alberta from pandemic management to endemic management. Measures related to contact tracing and a number of other things that emanated from her discussions with many peers and colleagues across the country who were observing positive trends in jurisdictions around the world with similar rates of vaccination, and based on an understanding that at an appropriate time we have to learn to live with COVID and address the multiple health and other social challenges that we face, including public health challenges. But in mid-August, Dr. Hinshaw, the Chief Medical Officer, reached out to me through the Minister of Health to indicate concern and a decision to suspend most of those measures that had been announced in late July. I chaired an Emergency Management Cabinet Committee meeting in mid-August to accept her recommendations to pause those measures that had been announced in late July. And I continued to be in daily contact with my staff and senior officials during the 2 weeks that I took personal time. The first 2 weeks I've taken that much time in over 3 years, now over 4 years, Mr. Speaker. So I continue to be in daily touch. Had there been further recommendations later in August to take additional measures, I would have immediately convened a Cabinet Committee meeting to approve those.
Leader of the Opposition.
Mr. Speaker, let me get this straight. I believe that the Premier is trying to give himself credit for the fact that the utterly ridiculous decision to stop contact tracing and asking infected people to isolate was reversed. I'm sorry. That is not what I meant. What I meant was this. You lurched forward, open for summer, everything's fine, get together in a room with 2,000 of your favorite friends and drink a lot. You did that because you were convinced that there was be a decoupling from case numbers and hospitalization. By mid-August, it was utterly clear that that was not true, that that was not happening, and that the cases were going back up, but also the hospitalizations were going back up, and the CMOH had modeling that showed that it was all happening, and you want us to give you credit for the fact that you reversed the decision not...
I'd just remind the Leader of the Opposition to speak through the chair. If you were speaking through the chair, you might say the Premier did this, the Premier did that, as opposed to you.
Thank you. Anyway, thanks for that time there, Mr. Speaker. So the fact of the matter is that the Premier and his cabinet had this information in the middle of August, and they did not do what was happening in every other province, which was a measured approach. So my question is, why was nothing else done? But also, let's talk about what could have been done, and that is vaccine passports. By this time, the Chamber of Commerce, the Flames, the Oilers, and interestingly, the province of BC, had all concluded this was the way to move forward. What happened here? The health minister declared, we will never go forward with a vaccine passport. Was that something that the Premier advised from his vacation somewhere in Europe when he was calling his health minister? Or was that a decision taken just by the health minister?
The Honourable Premier.
Well, first of all, Mr. Speaker, the Leader of the Opposition really reveals something about her approach to politics, with her obsession over credit and blame. Mr. Speaker, I wasn't seeking credit, but I know the Leader of the Opposition is obsessed with assigning blame. I'm here to talk about the facts, and the facts are this, that we received advice from the Chief Medical Officer to move from pandemic to endemic management at the end of July. We accepted that advice, and ultimately, it's the politically elected officials who must take responsibility for the advice that they take, and that I have taken responsibility for that. Then we received advice in mid-August to delay a number of those measures, and I immediately convened a meeting of the Emergency Management Committee of Cabinet to ratify those recommendations. Those are simply the facts. With respect to what the member opposite calls vaccine passports, the proof of vaccination or restriction exemption program, Mr. Speaker, it wasn't simply a position of the Minister of Health in the month of August, it was a position of every government in Canada until not long ago. Mr. Speaker, she laughs, but I was on calls with all 13 premiers and the Prime Minister in as late as April or May, when we were unanimous in our opposition to proof of vaccination programs for a number of valid reasons, Mr. Speaker, a number of valid reasons. Now, over the course of the summer, as new data began to emerge, and as every province started to see their vaccination rates start to stall out, provinces one by one began to take a different approach. Saskatchewan and New Brunswick after Alberta. But Mr. Speaker, we had legitimate reasons around privacy concerns, a number of other issues, and frankly, we were concerned that the perceived compulsion of that program would actually potentially reduce vaccination rates. So, Mr. Speaker, that explains why every government...
The Leader of the Opposition.
Well, Mr. Speaker, again, I was talking about the delay in implementing what was clearly an important public policy decision in the month of August, while Alberta was leading the country in case growth and hospitalization, while Alberta was being told that it was in deep, deep trouble. The rest of the country wasn't facing that. Just Alberta was. Yet, nobody was around to make a decision. So we know that on August 27th, 30% of surgeries in Edmonton were cancelled. And they were not elective surgeries. They were cancer surgeries. They were organ transplant surgeries. They were cardiac surgeries. They were surgeries on children. And we know that 30% of them were cancelled on the 27th, and then subsequently far more were later. We've all seen the AHS dashboard. We've all seen that they do projections there. We know what that looks like. So it's simply this. When exactly was the Premier or the Health Minister or anybody else in that cabinet over there advised that we were moving to the point of having to cancel up to 30% of surgeries in Edmonton and ultimately 100% everywhere else, 100% of elective surgeries? When were you advised? The dashboard probably had to give you at least 2 weeks' notice, probably more. When were you advised? What did the documentation look like? And why didn't you act on it? And why did we not hear from you from your vacation, from wherever you were? On the 27th of August, when the decisions of your cabinet to not take action resulted in 30% of elective surgeries in the city of Edmonton being cancelled, and subsequently elective surgeries across the province being cancelled.
The Honourable Premier.
Well, Mr. Speaker, I don't have a detailed diarised record of every bit of information I've received over the past several months, but I believe I was presented with broadly that situation at a verbal briefing at McDougall Centre in Calgary at or around that date, and that is when we began to consider additional measures that were taken on board by Cabinet and announced on September the 3rd, and then further measures that were announced on September the 14th. Mr. Speaker, whenever we've received advice to take additional public health measures, we have acted promptly. We have taken into serious consideration the public health advice that we receive and acted promptly. And I would say overwhelmingly over the course of the past 20 months, not in every respect on every detail, but I would say that broadly the Emergency Management Committee of Cabinet has accepted the advice that we've received. But ultimately, it's the elected actors that must accept responsibility for these matters, Mr. Speaker, as we do. At the end of the day, we believe the focus now must be on continuing to get those vaccination rates up and continue to act with care and prudence.
Honourable members, the debate will now continue in the following matter. For a period of not exceeding 10 minutes, the Honourable Minister of Health may make a statement. Immediately following the Minister of Health statement, for a period not exceeding 15 minutes, members who are not members of Executive Council may ask questions on matters related to the statement or the government's response to the COVID-19 pandemic. Any members of Executive Council may respond to those questions. Neither questions nor answers may exceed 2 minutes at a time. The Honourable the Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, the COVID-19 pandemic has taken a toll on Alberta, as it has done across Canada and virtually every country in the world. This global health crisis has tested healthcare, the economy, and civil society in every jurisdiction it has impacted. We naturally focus on the impacts within our own province, Mr. Speaker, but we must remember that this is a global pandemic and no country has been immune to its devastating effects. It is not unique to Alberta, not in the challenges it has posed, the impacts it has had on vulnerable people, the pressure it's created in the health system, the way we responded to it, or the ways we've had to change to adapt along the way. From the early days of the pandemic, Alberta has followed the science and made decisions with the information we had at the time. That's why in March 2020, we quickly scaled up a best-in-class testing program so we could test, trace, and isolate the virus. That's why we ramped up our provincial immunization program last winter so we could get doses into the arms of vulnerable Albertans and dedicated frontline healthcare workers as fast as possible. That's why we've implemented the vaccine incentives and the restrictions exemption program to reduce transmission and to help businesses keep operating safely and provide another incentive for Albertans to get vaccinated. As we've acknowledged many times, the move to managing COVID as an endemic back in July was too soon and we've since modified our response to get through the fourth wave and reduce pressure on our health system. Going forward, my mandate from the Premier is to continue to work to get past the fourth wave and prepare for the future. This mandate includes 3 priorities: increase baseline permanent healthcare capacity, increase surge capacity to ensure healthcare is not disrupted again if we have future waves of COVID-19, and to increase vaccinations. Mr. Speaker, we are getting through the fourth wave. New daily cases have been falling for 5 weeks, and they're down by more than half from the peak in late September. Hospital admissions have also been declining, slowly but steadily, for nearly 5 weeks. But they're declining from numbers that were far too high, and Mr. Speaker, they're still too high. The reality is our healthcare system remains under very significant pressure. As of yesterday, there were 689 patients in hospitals with COVID-19, including 157 in the ICU. That's a big reduction, and it's good news, but remember, there are other patients who need ICU care. In total, AHS reports today that they have 247 ICU patients compared to a baseline capacity of 173. So we're going the right way, but we need to get these numbers lower. AHS has done a tremendous job, adding as many as 200 surge spaces to the ICUs at peak. But that's a short-term solution. It's not optimal for care for patients, and it's not sustainable for staff and physicians. A lot of that surge capacity was created by converting spaces and resources that are normally reserved for patients who are getting major surgery. So those surgeries had to be postponed. That's a tremendously difficult decision, and I feel for all the patients and families who have been impacted. As we get through the fourth wave, AHS has been carefully increasing surgical volume to include a growing proportion of urgent surgeries as well as emergency cases. They've also started redeploying surgical staff and anesthetists back to their surgical roles following temporary ICU deployment. A few weeks ago, at the peak of the fourth wave, AHS warned that they might have to postpone up to 75% of all requested surgeries on a given day. In fact, they were able to keep doing slightly more than half of all surgeries, and they've made progress in improving since then. Most recently, they've been doing about 2/3 of all requested surgeries, and they're working hard to bring that number up. We'll update Albertans on the timeline to clear the backlog and begin to reduce wait times as soon as AHS can get back to more normal operations. Looking down the road, we're still firmly committed to the goal of doing every scheduled surgery in a clinically appropriate time. When we talk about the impact of COVID-19 on healthcare and on patients, obviously we need to talk about continuing care. This pandemic has taken a heavy toll on continuing care residents, families, and the systems itself in Alberta and in other jurisdictions. We've worked hard from the start to support our operators in giving residents safe care, and we continue to work with them to protect vulnerable seniors. We're continuing to provide a $2 wage top-up for healthcare aides at contracted continuing care facilities, addressing a key pressure on the workforce in contracted continuing care facilities during COVID-19. This past March, we committed up to $68.5 million in grant funding for supportive living operators, as well as home care services, hospices, and residential addiction and mental health treatment centers. Most recently, we put a priority on third dose of vaccine for all residents of congregate living facilities for seniors. That includes a total of 58,000 people in publicly funded continuing care, as well as privately funded facilities. As of October 29th, Mr. Speaker, nearly 38,000 of those residents have received third doses. That's about 2/3 of the total. We also introduced additional masking, testing, and quarantine measures for all continuing care facilities as of October 25th. And operators can put in place any additional measures that they think would be suitable for their residents, staff, and visitors. The result is that cases and outbreaks are down sharply, as they are in the wider community. And we're going to learn from the pandemic to make continuing care better and safer in the future. That's the goal of the facility-based continuing care review, and we're making changes to improve care right now, as well as planning for legislative changes that we'll bring forward in the spring. We're moving right now to improve public reporting on continuing care inspections, eliminate ward rooms shared by more than 2 people, and provide capital grant funding for Indigenous groups to develop continuing care capacity. As well, in September, we committed $36 million to increase home care capacity. This supports the shift to more care in the community, which is among the core directions recommended by the review. For right now, though, I'm focused on getting past the fourth wave. The key to that is vaccination. And Mr. Speaker, we're making real progress. Just today, we announced we've reached 80% of eligible Albertans fully vaccinated. That's more than 3.2 million Albertans out of the total of 3.8 million aged 12 and over. Since September 15th, about 264,000 more Albertans have received a first dose of vaccine, and 293,000 have received a second dose. Over 87% of eligible Albertans have at least one dose, just 2% the national average of 89%. Mr. Speaker, we are closing the gap through our incentives, the mandatory vaccination for the public service, and encouraging people through the REP program. We're working to put the pandemic behind us through vaccinations. In the meantime, as we've done from the start, we brought in public health measures in the most targeted and balanced way possible to reduce transmission of the virus and preserve capacity in our health system, while at the same time minimizing harms caused by the restrictions themselves. Mr. Speaker, we need to be clear. COVID is a real and urgent public health crisis, but restrictions also have harms of their own. There is not, and there never has been, any simple answer to COVID that comes without a cost. Restricting people from doing the things they value, including just visiting in each other's homes, closing businesses and depriving people of their livelihoods, turning kids away from school, these things have a profound cost on our quality of life and well-being, as well as on our shared prosperity. There are things that we should only do when we have to, and only to the extent we have to, in order to get COVID under control and protect our healthcare system. So we continue to try to strike the right balance based on the evidence and the advice of our Chief Medical Officer of Health. The REP program is just the latest example of striking that balance, and it's working. Just recently, the same BC modeling group that had predicted an even worse fourth wave had said that the REP program has been a big factor in bringing it down. So before I close, I also want to acknowledge our healthcare professionals who have worked tirelessly through this pandemic. I am so deeply grateful for everyone in the system who has helped make sure Albertans get the care they need throughout the pandemic, including getting us through the current wave. So to everyone in AHS and Covenant Health, and across the entire healthcare system, in family physician practices, continuing care, and home care, thank you for all you've done and continue to do. So to conclude, the Alberta government will continue to do everything in our power to encourage every eligible Albertan to get vaccinated. We will do so because we know it will help to spare them and those around them from the severe outcomes that COVID-19 can cause. We know it will help keep them out of the hospital and reduce the strain on our health system so that every Albertan who needs care can get it, whether it's surgery, a procedure, treatment, or a specialist visit. We'll keep building capacity in our healthcare system so we're ready for future waves in this pandemic or any other health crisis that may hit. We'll continue to learn from our experience here in Alberta and other jurisdictions and ensure we make the right policy moves. And we're pleased with the progress that we're making with the REP program. And that's why the REP program will stay in place to at least the first quarter of the new year before we consider reevaluating. We'll take whatever steps are required to get cases down, Mr. Speaker, and keep them down. We'll continue to make the best decisions on the best information available and the recommendations from our Chief Medical Officer of Health, and we'll continue to support the health system for all Albertans. Thank you.
Honourable members, for a period of 15 minutes from 8:58 to 9:13. Any members not, it's okay, you can stay standing if you want. Any member not of Executive Council may ask a question for a period of not exceeding 2 minutes, and any member of Executive Council may answer that question for a period not exceeding 2 minutes. I see the Honourable Member for Edmonton City Centre, and that will be followed by the Honourable Member for Cypress Medicine Hat, and I'm not sure if the member, excellent. The Honourable Member for Edmonton City Centre.
Thank you, Mr. Speaker. I'd like to start by talking about surgeries. Now, we know, as the Leader of the Opposition said, by the end of August, we had seen AHS move towards cancelling 30% of all surgeries. It did not take long to progress to the point where more or less all surgeries in the province of Alberta had to be halted. Now, we had certainly heard from frontline healthcare workers. I know I was hearing from surgeons and others on the front lines about the building pressure and warning that we were going to arrive here. Yet the government let things drive to the point where we reached. So we have been asking the Minister of Health about this. On October 25th and 26th, we asked him specifically how many Albertans had their procedures postponed. And both times he could not or would not provide an answer. Now, he's had a week, and we know that as of about a month ago, AHS could say definitively there had been 8,500 surgeries canceled. Now, things I'm sure have advanced since then, and I'm sure that AHS is tracking these numbers. I'm sure the minister is in conversation with them about these numbers, and he has had a week to assemble those numbers. So we'll ask the minister again tonight, will he tell us, to date, how many surgeries have been canceled? How many Albertans have had their procedures postponed? And if he deflects to say, well, we will talk about that later, could he clarify if that is because he does not have that information? Can he explain why AHS is not tracking that information? Or can he identify why he has that information and is refusing to be transparent and accountable and share that information, those specific numbers, with Albertans?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, first of all, I just want to correct the record. The honourable member across the aisle indicated that all surgeries were postponed. Mr. Speaker, that is simply not correct. As I noted in my remarks, AHS was prepared to postpone up to 75% of surgeries and procedures. Fortunately, they did not have to postpone that many to be able to create capacity. They postponed at the worst 50%, and now we're on the long climb back. To be able to recover that, we're up to about 2/3 of surgeries that are requested that are being done right now. But Mr. Speaker, in regards to the question about the actual number, as I indicated to the honourable member, and as I'm sure the honourable member recognized, we're not at 100% yet, and the system is still fragile. We still have we're still moving staff who are in providing support for temporary ICU beds back into surgeries. And so that number fluctuates from day to day in terms of it's about 2/3, but that still fluctuates from day to day in terms of the number of surgeries that we're getting done. So, Mr. Speaker, as I indicated beforehand, I am prepared to come back to the House with a plan, with the number of surgeries that the backlog is, and also not only the backlog, but also when we talk about backlog, it's the number of surgeries, the days of waiting, for particular individuals that they're past the recommended time. I'll be able to come to the House, not only be able to explain that, but with a plan moving forward, because Mr. Speaker, that's our focus right now. Our focus right now is getting past the fourth wave, and that's what I've asked AHS to do. And I've asked, as part of this, as the numbers start coming down, to actually plan more surgeries so we can get caught up. So I will explain to the members of this House, to the member opposite, in regards to the backlog, and that backlog is continuing to accrue. But we'll explain when we have the plan, and that'll come in the coming weeks.
Thank you, Honourable Minister. I see the Honourable Member for Cypress Medicine Hat has risen.
Oh, thank you, Mr. Speaker. Mr. Speaker, this is frustrating. 60 private members representing millions of Albertans are sharing 15 minutes in Alberta's huge, biggest health crisis ever. It's incredible. We asked for a standing order 42, an emergency debate. The official opposition did it, and it was denied for 15 minutes amongst over 60 of us. Mr. Speaker, but guess who else isn't getting the opportunity to speak? The Chief Medical Officer of Health. You may recall under Bill 66, supported by the official opposition, me and my honourable colleague from Central Peace Notley proposed an amendment. So the Chief Medical Officer of Health would go to the Committee on Families and Communities, would answer written questions from MLAs so we could truly represent the thousands of Albertans we represent. The Premier came out of his office one night and shut that down. So my first part of my question is to the government. What are you hiding? Why won't you let us talk to the Chief Medical Officer of Health? And you know what I'd ask her? I'd ask what the honourable member from Athabasca, Barrhead and Westlock asked the Health Minister yesterday, and I don't think he got an answer. How come we're not considering natural immunity? How come we're not pairing natural immunity with a negative test? How come we have totally disregarded what many scientists are saying needs to be looked at? And Mr. Speaker, while we're here, how come we're not discussing paying for rapid tests for lower income people? This pandemic has been so hard on so many families and so many lower income people, and I barely hear a word of that from the government. While we're at it, I just heard the Premier and the official leader of the opposition so concerned about open for summer, the best plan, and all the PR that was around that. How come weather wasn't considered in the pandemic as we're into the 20th month? Where has this government been? Let's talk to the Chief Medical Officer of Health, natural immunity, let's help the poorer families.
Thank you, honourable members. Are there any? I see the honourable Minister of Health has risen.
Well, thank you, Mr. Speaker. I just wanted to speak to one item that the honourable member raised there, and this is in regards to, our focus, and our focus is on vaccinations. Mr. Speaker, we know that vaccinations work. They have been incredibly successful throughout COVID-19. We know that one of the challenges Alberta faced was a lower vaccination rate than certain other jurisdictions. And that led to, unfortunately, a number of people with severe outcomes. Mr. Speaker, we know that during the fourth wave, over 90% of people in ICU were not fully vaccinated, and over 80% hospitalized not fully vaccinated. So, Mr. Speaker, that is why my approach and the approach of this government is to focus on increasing vaccinations. And, Mr. Speaker, we have been successful in doing that through a number of measures, including, and as the Premier spoke to, including providing more information about vaccination to deal with vaccine hesitancy, including putting in programs that would actually focus on incentives, the $100, for example, and also one of the side benefits of the REP program was actually people to turn their minds to getting vaccinated and be able to get that vaccination done as quickly as possible. And through that, Mr. Speaker, over the course of September and to now, we've been able to increase first doses from 78% to 87%, just 2% shy of the average in the country. And also, we've been able to increase our second doses of 80% and get protection for not only Albertans, the protection that they need from severe outcomes, but also, very importantly, Mr. Speaker, we've been able to see the numbers come down in regards to hospitalization in ICU, provide relief for our healthcare workers, and be able to get more and more surgery scheduled. And we're going to be focused on the backlog and continue to get the vaccinations up, Mr. Speaker.
I see the honourable member for Lac St. Anne Parkland has risen.
Yeah, thank you, Mr. Speaker. Thanks to the fellow colleagues, all MLAs, non-partisan items here, getting a chance to talk, and minister and former ministers as well of dealing with this. I think we've all been public piñatas for the last 20 months, trying to walk the minefield of what's right, what our constituents feel, and quite honestly, some of the social engineering that's taking place. We've got people's emotions all amped up. Prior life, I keep coming back to resource planning, Minister. You know that full well. If AHS was working well, we never would have campaigned on trying to fix it. We wouldn't have had all the surgical backlog, everything else that was taking place. We've done a stress test with this system, and it keeps coming back to ICU capacity, the training, how we get folks in there. I've heard lots of talk about vaccine passports being the passport to the future. I don't accept that. Nothing is so permanent as temporary. Let's make sure a lot of these measures and controls we're putting in place have a definitive end date, because the folks in my area will not tolerate it, nor will Albertans, if this keeps protracting too long. And if we're looking at jurisdictions in the world, the biggest superpower to the south of us, only 6 states have vaccine passports. Everybody else is either blank or they've ruled against it. I get very concerned when we start talking about making mandatory vaccinations. We all voted against that. Let's not go down that road. We also voted against mandatory vaccine passports. Restricted access programs, again, you know the metrics have to be based on some empirical testing, crowd size, rapid tests, all those things I can get on side with. And in my constituents, to show you some opposite ends of the stick, one lady's telling me the only jurisdiction that got it right was China. We should instill communist law. Another one says don't do anything at all. So I honestly empathize with you. But again, the folks in my area have vaccine hesitance for a lot of very valid reasons, including 63 healthcare professionals that I tabled all of their items internally. AHS is pushing a lot of folks to the limit. We have to understand that this is getting polarized, and it's pushing a lot of people that we need as resources out the door that have tons of experience. So I humbly request that everyone ratchet down the conjecture and partisans. Let's get back to work and figure out the system.
Thank you. I see the Honourable Minister of Health has risen to respond.
So first of all, I want to thank the honourable member for your comments and thoughtful comments, particularly in regards to treating everyone with compassion and respect. This discussion, there has been polarizing views on either side, and we have to remember throughout all of this, we are all Albertans. We all want to build this province together, and we all want to get through COVID-19 together and come out the other end stronger as a province, stronger as a society, and focus on jobs, the economy, and improving our province as we work together. The honourable member had a couple of comments regarding capacity and some of the concerns regarding ICU capacity. At first, I want to thank AHS, Covenant Health, and all healthcare workers for stepping up during the fourth wave to create the capacity that we needed. And as I indicated earlier in this House, Mr. Speaker, we were able to create sufficient capacity with a combination of restrictions that were in place to bring the cases down. So we had enough capacity, so we didn't have to turn anyone away, Mr. Speaker, and that was incredibly important. But I also understand the comments made by the honourable member is that we need to look at this going forward. We need to look at the capacity. How do we create permanent capacity, and how can we create capacity that is more flexible to be able to handle the potential next wave of COVID-19 without such a negative impact on our healthcare system? Mr. Speaker, that is one of my key priorities that I indicated earlier. That is what the Premier asked me to do, and Mr. Speaker, we're doing work on that right now to try to understand the capacity question, so we're not going to be in this position again, and we have the capacity to be able to protect Albertans and Albertans' healthcare going forward. Thank you.
Are there any? I see the honourable member for Edmonton City Centre.
Thank you, Mr. Speaker. Now, it was obvious for weeks that the healthcare system was already straining to keep beds open due to a staffing shortage. Now, we know this began back in May. In fact, I recall in early May, the 12-hour closure of the emergency department at the Fairview Health Complex. That was followed by closures of beds or emergency departments in Edson, Boyle, Rocky Mountain House, St. Paul, Galahad, Westlock, Consort, Fort Vermilion, McLennan, Spirit River, Sylvan Lake, Fort Macleod, Consort, Milk River, Daysland, and Manning, not to mention the ER bed closures at the Royal Alex Hospital and the Red Deer Hospital. So it was very clear, well before we got to the worst of this fourth wave, that we had a crisis building, yet we saw no action from this government. These frontline healthcare workers, who we had a critical shortage of, physicians, nurses, anesthesiologists, others who were required to keep these facilities running, were speaking out about the pressures they were facing, about the concerns they had, about the case counts they saw rising in their emergency departments and coming to their hospitals. And all along, what we saw through May, through the end of July, is the then Minister of Health standing and saying that we were lying or giving misinformation. I apologize, I won't use that word. We were giving misinformation about the situation. Indeed, that the frontline healthcare workers themselves that were speaking out were giving misinformation. So to the Minister of Health, why did you not take this into consideration, or was this discussed at the cabinet table? At what point did you recognize that the increasing pressure on our hospitals, the critical care shortage, that critical staffing shortage, was going to combine with the rising fourth wave to force us into exactly the position that we find ourselves today?
Thank you for the apology on that. I will also just give the honourable minister 15 seconds should he choose to just take it on this, and then we'll move on to the next minister.
I'll just recognize we're short of time. I'll just comment. As I commented to the previous member, my focus is actually addressing capacity issues moving forward. That is a mandate given to me by the Premier. I fully recognize there's going to be human resource issues associated with this, and that's on the top of my radar.
Honourable members, debate will now proceed in the following manner. Any member of Executive Council may make a statement not exceeding 10 minutes immediately following each statement made by a member of Executive Council and for a period not exceeding 15 minutes. Any member who is not a member of Executive Council may pose questions on matters relevant to the statement or the government's response to the COVID-19 pandemic. Any member of Executive Council may respond to those questions, and neither the questions nor the responses may exceed 2 minutes, as we have seen up to this point. Immediately after all statements and related periods for questions and responses have concluded, the debate is considered to have been concluded by the Assembly without decision. The debate may be adjourned at any time. I believe that there are a few ministers that are looking to join with comments. I believe that I see the Honourable Minister of Finance has risen.
Well, thank you, Mr. Speaker. It's always a pleasure to rise in this House and provide a perspective from the government during a perspective that will encompass the last 18 months, Mr. Speaker, 18 months that have been very difficult for so many Albertans. I want to take us back to, all the way back to February of 2020 when it became evident, apparent, that we would be dealing with a pandemic in this province, Mr. Speaker. And I want to again take us back to our final deliberations around Budget 2020 when really at the last minute we added $500 million to the health budget in 2020 for the Budget 2020. And Mr. Speaker, that was because even at that point in time, while we didn't know the time, we didn't know the duration, and certainly not the severity of the pandemic, Mr. Speaker, we knew that we would be dealing with a pandemic. And so this House agreed on adding $500 million to health's budget. And Mr. Speaker, we did that because the number one priority back in February of 2020, back in the spring of 2020, and during this fourth wave, from a financial standpoint, from a financial perspective, was to ensure that healthcare was resourced adequately to deal with the pandemic challenge. And so, Mr. Speaker, when we were deliberating about Budget 2021, Mr. Speaker, we added $900 million to that budget. And in every year, the fiscal plan, Mr. Speaker, to deal with the surgical backlog that arose during the pandemic. And Mr. Speaker, at the same time, we added a $1.25 billion contingency to health because we knew we weren't past the pandemic when we developed the budget. And we wanted to ensure that health would be adequately resourced to deal with the pandemic challenges. Mr. Speaker, these funds were to be used for, and in fact have been used for, testing and contact tracing, personal protective equipment for our healthcare staff and workers, Mr. Speaker, for acute care costs, as we've had to ramp up ICUs right across the province. Mr. Speaker, I can say that in addition to the $500 million that we added to the 2020 health budget, we spent a further $1.5 billion in health to combat COVID-19. So, Mr. Speaker, the battle has been costly. The battle has been costly, certainly to Albertans who have lost loved ones due to this pandemic. Mr. Speaker, the battle has been costly to our healthcare workers who have battled on the front lines in our hospitals and in our ICUs, who've battled in our nursing homes and continuing care homes. And Mr. Speaker, the battle, the sacrifice has been significant for so many Albertans as we've struggled economically with the pandemic and, of course, with all the other factors that have surrounded the pandemic. In fact, Mr. Speaker, I do want to talk a little bit about the economy because we've characterized it in this way in the past, and Mr. Speaker, I think it fits. For Alberta, we really experienced a triple black swan event. This was not just one event that affected the province, but Mr. Speaker, it was really three events. We were dealing with a global pandemic and a pandemic that had reached our borders and in fact was inside our province. We were dealing with the largest economic contraction, global contraction in modern history. And Mr. Speaker, we were dealing with the largest collapse in energy prices in modern history as well. And of course, that disproportionately affected Alberta. But Mr. Speaker, we did respond quickly. And again, I would like to take us way back to the spring of 2020 when it became clear that we were going to have to move forward with very significant public health measures that would affect businesses and Albertans. Mr. Speaker, during that time, thousands of Albertans lost their job as restaurants closed and businesses closed, some retail services closed. And Mr. Speaker, we moved forward with programming for our most vulnerable, for the homeless, for all Albertans to support them with their mental health. Mr. Speaker, we immediately brought forward the Emergency Isolation Program, a program that would allow individuals without any other form of safety net to step away and isolate if they believed they might in fact have been in contact with somebody with COVID. Mr. Speaker, for businesses, we deferred business taxes, corporate taxes. We froze education property taxes. We deferred and abated workers' compensation board premiums. We provided commercial rent assistance. And Mr. Speaker, we provided small business relaunch grants. In fact, almost $800 million worth of small business relaunch grants, Mr. Speaker. We provided assistance for families, for child care support, education supports, the critical worker benefit, and I could go on and on. Mr. Speaker, I've got about 6 pages of programming that was all earmarked for Albertans and Alberta businesses to help us get through this very difficult and challenging time. I could go on. But Mr. Speaker, at the same time, we recognized that we also needed to position the province for economic recovery. We needed to position the province for better times. And Mr. Speaker, we needed to do it for a number of reasons. Firstly, there were tens of thousands of Albertans that desperately needed a job opportunity. Mr. Speaker, we had tens of thousands of Albertans that lost their jobs during the early days of the pandemic, and we desperately needed to find them a job opportunity. Mr. Speaker, we also needed to position the province for economic recovery to ensure that the government had sustainable revenues to pay for necessary government services going forward. So, Mr. Speaker, back in June of 2020, we launched the first version of the Alberta Economic Recovery Plan. And Mr. Speaker, at that point in time, it was largely a framework, but we felt it was very important to communicate to Albertans, to Canadian investors, and in fact, the global investment community, that in spite of our challenges, Alberta was open for business, and we were going to do all we could to position the province for disproportionate investment attraction, job creation, and economic growth. Mr. Speaker, our plan had several pieces to it, but the fundamental principle, the foundational part of this plan was to ensure that we had the most competitive business environment broadly in this province. So, Mr. Speaker, as part of our announcement, we fast-tracked the job creation tax cut, moving business taxes expeditiously from 10 to 8%, which ultimately left us with a tax environment, a tax rate 1/3 lower than the next closest province in the country, Mr. Speaker, and amongst the lowest jurisdictions in all of North America. We introduced the Innovation Employment Grant, Mr. Speaker, an important support and incentive for businesses across sectors to invest in necessary research and development activity, because, Mr. Speaker, we know that it's critical to maintain the competitiveness of Alberta businesses going forward. Research and development, technology, innovation, and commercialization is critical, and it's vital. And, Mr. Speaker, we continued to reduce the regulatory burden on Alberta businesses. We continued to work on modernizing our regulatory environment. And, Mr. Speaker, I can say on that front, we have taken our province from an F grade to an A grade based on the Canadian Federation of Independent Business, and yet our work is not done. We continue to work to modernize our regulatory environment. Mr. Speaker, as I see my time is running out, I do want to say this: our plan is working. I am very pleased to announce today that major banks, that economic think tanks across this nation are predicting Alberta to lead the nation in economic growth this year and next year, Mr. Speaker. In our Q1 fiscal update, we're projecting Alberta's real GDP growth to be 6.7%. Mr. Speaker, we fully recovered the jobs lost during the pandemic, and investment is returning. Energy investment is rising, Mr. Speaker. The agriculture industry's had a tough year, but, Mr. Speaker, even there we see commodity prices that leave me encouraged, Mr. Speaker. Our economy is recovering.
Thank you, honourable members. We will now move to a period not exceeding 15 minutes, where any member who is not a member of Executive Council may pose questions. I do want to just also take this moment to remind all those that the rules of this debate do call for questions. So within that 2-minute period, standing up and making comments, it could have been that one member in the last round simply just ran out of time, and that's fine. However, I just want to remind all members that the purpose of that question period is to ask questions. The individual who caught my eye is the honourable member for Central Peace Notley.
Thank you very much, Mr. Speaker. I guess listening to the previous speaker, the Minister of Finance, talk, I just wanted to make, I guess, a couple comments before I get to my questions. He talked about the front care workers and how they battled, and of course we've seen healthcare workers. Of course, he mentioned how they battled through this last 18, 19 months of COVID, and I guess my concern is that the thanks that these people get is to be laid off, and I think that's truly unfortunate. We're sitting in the middle of a healthcare crisis, and our answer to a healthcare crisis is to lay healthcare workers off. He talks about the economy suffering, and people do, and of course, yes, the economy is suffering. People are losing their jobs, but a lot of it is inflicted by government regulations. We see long-haul truckers who now can't access restaurants. So when they have a chance to stop and have a break, they can't go into the restaurants. They have to take their food out and eat in the sleepers of their truck or outside or wherever. And so, and also the minister talked about so many benefits, dollars being handed out to businesses, but I think businesses, they don't want handouts. They would just want to operate their business, and they want to do it safely. And I think they should be respected for that. But I'll get to my questions now. And this is, I guess, to the Minister of Health. I asked these questions earlier. And so I'll ask him again. If the purpose of a vaccine passport is increased vaccination rates, what is the target vaccination rate? And the second question is, what percentage of ICU usage does Alberta need to hit before this government will lift emergency restrictions, including vaccine passports? So I think what Albertans want to see is that at this point anyways, there's a lot of frustration, a lot of anger, there's a lot of divisiveness that this government has created. And I think we need to at least give people just a little bit of hope and tell them what the plan is. There has to be a plan, there has to be numbers. Somebody must have discussed this and come up with something when all this can come to an end. Thank you.
Thank you, Honourable Member. Are there members from Executive Council looking to respond? I see the Honourable Minister of Health has risen.
Thank you, Mr. Speaker. And to the Honourable Member, in terms of your question, you were asking in regards to the purpose of the REP is increased vaccination. Actually, the primary purpose of the REP, Mr. Speaker, is to enable businesses to operate while protecting individuals, and really it was all about reducing the increase in the case count so that we can. So reducing the case count so we can reduce the strain of our hospital system and reduce the strain in our ICUs. Now, we all know, Mr. Speaker, that one of the side effects of the REP is actually it says to people that now is now for those who haven't been vaccinated, you can either be vaccinated or you can choose to get tested and use that as part of the REP program. But many people have chosen to get vaccinated, and I was very pleased to see that. And we've had an increase. Mr. Speaker, the honourable member asked the question in terms of, well, what is the number that we need to hit before we can pull this off? We can remove the restrictions. When are the restrictions coming off? And I fully appreciate, Mr. Speaker, that there are a number of Albertans who are asking those questions. As indicated by the Premier already, we are moving, even though the numbers are coming down, which is very helpful. Our ICU count is still incredibly high. As indicated earlier, that we still are not back to 100% of regularly scheduled surgeries at this point in time, Mr. Speaker. And as a result, it's incredibly important that we maintain the measures at this point in time. As well, we're coming into a period of time, seasonality, with people moving indoors, the risk of spread, and not only through this season, but also potentially into next year, the winter season, which is another flu season. So, Mr. Speaker, as indicated by the Premier, we are not looking to remove the REP until at least the first quarter of next year, at which point in time we'll actually take a look at that then.
Thank you, Honourable Members. The individual who caught my eye is the Honourable Member for Edmonton Manning.
Well, thank you, Mr. Speaker, and I'm going to go back again to the Minister of Finance because I have a very serious question that I think Albertans have been looking for an answer for a long period of time, and we're still waiting and haven't had it yet. So, according to Dr. Hinshaw, during the month of August, COVID became a significant problem. Her decoupling theory decoupled. We have the FOIP calendar for August for the Premier. I know the calendar is important because, of course, it shows staff and the public sector where the Premier is and how to get a hold of him. In the calendar, it indicated the Premier was on personal time from August 13th to August 30th, and for most of the time, the Premier was out of the country. So to the Minister of Finance, you are second in order of precedence. This means legally you have a responsibility to take over for the Premier. Were you assigned that duty? And if not, who was?
I see the Honourable Minister of Finance is rising to respond.
Well, thank you, Mr. Speaker. I do want to say the notion, the assertion that the member opposite made is correct. And, Mr. Speaker, I think the Premier and Health Minister have done a good job tonight, laying out the circumstances in August, the advice that we'd received, the modelling that we were privy to, and how in September, when it became apparent that our situation here in the province was different than what it first appeared to be, or it appeared to be based on the modelling, that there was very quick, nimble adjustments made to our approach to public health in this province. But, Mr. Speaker, I will take the time to note that, yes, I was here in August, and I was pleased to rise and provide a fiscal update, Mr. Speaker, during that time. In fact, I believe the second last day in August. And that fiscal update demonstrated the fact that, Mr. Speaker, while we were dealing with the pandemic, and we were necessarily in September required to make adjustments and solely focus on our response, Mr. Speaker, the financial update did reveal that our economy was on track and that revenues were improving exponentially, Mr. Speaker. In fact, I was able to rise at that point in time and share with Albertans that revenues exceeded budget by over $10 billion. And, Mr. Speaker, it really demonstrated that our economic recovery plan in this province was on track. We were attracting investment, and we were creating jobs and opportunities for Albertans. And Mr. Speaker, ensuring that this government, all of that ensures that this government has the necessary revenues to deal with challenges that we might find ourselves in, such as the pandemic and the required adjustments we had to make in September of last fall.
Thank you. I see the Honourable Member for Drayton Valley Devon has risen.
Thank you, Mr. Speaker. I know that the COVID pandemic has been very hard on everyone across this province and especially in my constituency. And it literally breaks my heart when I receive almost daily phone calls from constituents that are losing their jobs because of the mandatory vaccination policy. I have doctors, I have nurses that are absolutely some of the best in their field that are losing their jobs as a result of mandatory vaccinations. So the questions I have and perhaps Minister, go ahead, take your seat. When will the government, and I know that this government values the workers of this province, when will the government be prepared to adopt a policy of proof of immunity and rapid testing rather than the proof of vaccination? And I know that there are vaccine-hesitant Albertans who do not trust the mRNA vaccines and who would be willing to take a J&J in order to keep their jobs. And so can you tell us and the people of Alberta tonight when we will be able to receive J&J and when we will be able to see a policy shift away from proof of vaccination to proof of immunity? We know that this is important for the people in my constituency, for the people that are looking to keep their jobs. Thank you.
Thank you. I see the Honourable Minister of Health has risen to respond.
Thank you, Mr. Speaker, and thank you to the Honourable Member for the question. First, I'd like to deal with Janssen, the vaccine. So this is a vaccine that Alberta has requested along with 6 other provinces. Again, it's the federal government that is responsible for procuring the vaccine. I spoke with my federal counterpart, several weeks ago asking for a supply of J&J, and I understand that the federal government is working very diligently to bring in a supply from Europe, as well as I understand that Health Canada has gone down to the plant that manufactures the vaccine in the United States, from which our first shipment came from, but there was a problem with that shipment. They couldn't use it, so we went back to inspect it again. I understand that was a successful inspection. So I can't give the honourable member an exact time, but I am told that there is a shipment coming from Europe. So we've requested 20,000 doses. The initial shipment may be about 5,000 because it wasn't a full amount, and we expect that very soon, within the next few weeks, to be able to arrive. But we'll be able to update the House and the member towards the end of the week and maybe early next week in terms of J&J. And then, but once we actually get confirmation that we actually can receive it, then we'll actually be able to put in place we'll be able to roll out the process so that those who are interested in Janssen can get access to that. In regards to the other question, in regards to AHS and their policy, again, this is an AHS policy, as the honourable member knows. There has been an extension that was announced to be able to provide more time for AHS to assess the employees and the numbers that are vaccinated, and they're continuing to have conversations with employees at this point in time.
Thank you, Honourable Minister. I see the Honourable Member for Edmonton and Manning has risen.
Well, thank you, Mr. Speaker. I'm going to go back to the Minister of Finance again, because I do want to appreciate that he did stand and made some comments. But I'd like to pivot to supports for businesses, because I think ultimately that is one of the priorities and one of the things we do need to be focusing on here. And the concern that I have, and the opposition has had, in regards to the supports for the economy through the different waves of COVID. Now, we've heard the minister stand and speak to SMERG, or SMERG, or whatever we're calling it, SMERG payments, and how that's supposed to be helping the small and medium-sized businesses. The issue that we've seen here, though, is that many of those businesses, and we have the FOIP to demonstrate, that 4,600 businesses have already been denied those supports. We're also hearing on the significant impact, and I've spoken to small businesses who, given the immediacy of some of the restrictions that were put in place, were significantly financially impacted during different times throughout the last wave. And so the question that I have to the minister, and one thing I also want to highlight too, is recognizing that the Calgary Chamber of Commerce and other organizations were also calling for a vaccine passport way before the government ever put it in place, because they recognized part of the barrier was the fact that people weren't willing and wanting to go out to eat, or weren't even able to have in-dining services because of the fact that there was no mechanism in place. So, to the minister, why was the government so delayed in putting in these supports for small and medium-sized businesses? Why was the government, my apologies, not listening to places like the Calgary Chamber of Commerce when they were saying we needed these supports to be able to keep our businesses running and to keeping them open? And we've seen this throughout all of COVID. Oh, my apologies.
I see the Honourable Minister of Jobs, the Economy and Innovation has risen.
Thank you, Mr. Speaker, and I'll try and answer at least a couple of the questions that were posed there that are within my ministry. As it relates to the relaunch grant, we've had numerous iterations of the relaunch grant during different waves of the pandemic. In kind of a sum total, businesses could have qualified up to $30,000 depending on the revenue of that business. We received, and actually we provided funds to 125,000 applicants. Well north of $700 million flowed through that program to businesses across Alberta. On top of that, right now as well, we have followed up in August and September with every applicant where information may not have been complete or where we had further questions. So when the member references their FOIP request that they have there, each and every one of those parties would have been reached out to. Sometimes as well, though, the contact information that's provided may be missing a letter and an email. Maybe maybe missed a number and a phone number. So we have diligently reached out to every single one of those parties, to make sure that we get that final information. Again, we're asking all members of this House, if they have people, we'll gladly follow up with them as well.
Thank you, and good timing because that ends that block. I would now offer the opportunity for another member of Executive Council to make a statement. Should there be interest on that front? I see the Honourable Minister of Education has risen.
Thank you, Mr. Speaker, and I'm pleased to rise today and provide an overview of the many ways Alberta's government has supported students and schools during the COVID-19 pandemic. Learning during this pandemic has been a challenge for the entire education community, not just here in Alberta, but right across Canada, and I dare say around the world. We know how important it is to be flexible and to respond effectively to the needs of students as the public health situation changes. Mr. Speaker, I want to begin by restating that the safety of staff and students has always been our #1 priority throughout the whole pandemic, and it always will be. We have monitored the situation very closely and have followed the advice of Alberta's Chief Medical Officer of Health to ensure that students can continue to learn safely in their classrooms. Alberta's students deserve and should expect the best education possible, and I'm proud to say that we have supported them during every phase of this pandemic. Our announcement of additional supports last Wednesday is just one such example. On Wednesday, we announced, as part of Alberta's recovery plan, that we are distributing $45 million to school authorities to address learning disruptions that were caused by the pandemic to our youngest students. This followed on the heels of literacy and numeracy assessments done by school authorities earlier this school year, when we had earmarked those dollars to address this very issue. This funding will now enable school authorities to offer focused programming above and beyond classroom learning to those students identified as in need of extra supports. It means that schools can increase supports to improve reading and writing and numeracy skills for younger students who have fallen behind during this pandemic. School authorities have the flexibility to use funding to design programming interventions that best meets the needs of their students, such as introducing new programming or enhancing or extending existing programs and supports. In addition, this could mean increasing the intensity of programming for students, including forming small groups or one-to-one support, hiring additional staff, implementing new numeracy programming for early year students, increasing targeted parent communication programs, or involving parents in more programming, or ensuring staff who are providing these interventions to students have the necessary supports and tools they need, such as subs to release teachers for this particular time. Based on feedback we received from school authorities, the initial focus of this programming will be on students in grades 2 to 3 this fall, with targeted supports for students in grades 1 starting in February of 2022, once their assessments have been completed. Approximately 60,000 literacy and numeracy program opportunities for students in grades 2 and 3 will be supported with this funding, and some students would qualify for both supports. So once grade 1 students are assessed in the new year, we will know how many students in that grade will need extra supports. In addition to those measures, we have also been flexible and responsive to the needs of our students. For example, we recently heard concerns from older students about the stress and anxiety related to academic achievement during COVID, particularly for grade 12 high school students writing diploma exams. This includes members of my Minister's Youth Advisory Council, who were very frank and eloquent in providing me with their perspectives on the value and challenges of those exams and offering well-thought-out solutions. And last Wednesday, we responded to those concerns and suggestions by announcing that the weighting of the grade 12 diploma exams will be lowered to 10% from the usual 30% for this school year. This change will give students the crucial exam writing experience they need if they choose to go into post-secondary, while recognizing the impact the pandemic has had on their learning. That same afternoon, the Minister of Advanced Education and I also sent a joint letter to Alberta's post-secondary institutions to advise them of the change in the grade 12 diploma exam weighting. We encourage them to consider the ongoing impacts the pandemic has had on students who are applying to their post-secondary institutions, because we know what they have been going through. In response to the fourth wave, we have also begun offering and distributing at-home rapid COVID tests to staff and to students who are currently too young to be vaccinated. They are being offered first to kindergarten to grade 6 schools across the province that are on outbreak status. These tests will provide a way that is quick to identify people without symptoms who may have COVID-19. The tests are simple to administer and offer results within 20 minutes. They provide an effective way to slow the spread of the virus in areas with higher case rates, which is why the initial focus of this program will be on schools in outbreak status. The program is voluntary and it's free. Resources such as instructional videos and fact sheets have been posted with other COVID-19 resources on the alberta.ca COVID website. These will help parents and other guardians administer the tests. Mr. Speaker, I would remind the House that we continue to voice our support for school authorities to consider adopting proof of vaccination policies or proof of negative rapid tests for adults, including staff that enter schools. Of course, these are just some of the more recent examples of how we have been supporting and responding to the needs of students and the educational system. These build on all the other supports and measures in place in our schools that keep them safe for in-person learning, such as ensuring teachers and support staff were eligible for vaccines in early May, with children 12 and older becoming eligible soon after, as well as the at-home rapid test program that we put in place last school year and the in-school vaccination clinics. Throughout the pandemic, school authorities have been provided generous amounts of funding and resources to manage COVID-19. Since the pandemic began, school authorities have had access to over $1 billion in funding for COVID-related costs. This included a $120 million increase in operating funding for all school authorities across the province in the 2020-2021 school year, $10 million in PPE for students and staff, $250 million in accelerated capital maintenance and renewal funding, of which approximately $44 million went to HVAC and ventilation upgrades, and access to taxpayer-funded school board reserves, which at the start of the pandemic were $363 million and now are well over $400 million, and this is available across the province. Additionally, the $262 million that the federal government transferred to our province for the Safe Return to School program funding was distributed fully throughout the province to all school authorities. And on top of that, Budget 2021 also provided school divisions with $130 million in COVID mitigation funding for the 21-22 school year. We also gave school authorities as much flexibility as possible for COVID supports. As school authorities know their local context best, they could use the funding in the ways that are most important for their schools and their school communities. Mr. Speaker, as I stated earlier, I want to reflect on the amount that school divisions have available to them through their reserves. At the start of the pandemic, school divisions had $363 million available in taxpayer-funded reserves. Now, as I said earlier, early indications show that there is over $400 million available. This means that school divisions have been able to save more than $40 million during the pandemic. I'm confident they have the financial resources they need to support their students. One challenge that we have all faced during this pandemic is maintaining good mental health. And I'm proud to remind the House that Alberta's government has provided more than $53 million to make it easier for Albertans, including students and their families, to access mental health supports and referrals from anywhere in the province during and after the pandemic. Part of this funding went towards expanding the Kids Help Phone, mental health helpline, and the addiction helpline. We also partnered with jack.org to create a resource hub for youth mental health. I encourage everyone to become familiar with these tools and resources and supports, and to share them with students, children, and youth in their lives. I'm sure the Child and Youth Wellbeing Panel will also further provide recommendations to share with all Albertans, and we look forward to seeing that report. Mr. Speaker, these are just some of the many actions we have taken and supports provided for students and the education system as a whole since the pandemic began. I'll say this again, Mr. Speaker, because I believe it is the most important point to make. The safety of students and staff has been and will always be our #1 priority. As we have always done, we will continue to monitor the situation as this pandemic evolves, follow expert medical advice, and be flexible enough and thoughtful enough and balanced in responding to the needs of Alberta students. I want to close now.
Honourable members, for a period not exceeding 15 minutes, the members of non-members of Executive Council will have the opportunity to ask questions not exceeding a period of 2 minutes, and any member of Executive Council may respond. That will take us to 10:05. The order as it stands is the official opposition, the Honourable Member for Edmonton Glenora, followed by the Honourable Member for Cypress Medicine Hat, followed by the Honourable Member for Drayton Valley Devon, followed by a member of the opposition if time allows. The Honourable Member for Edmonton Glenora.
Thank you very much, Mr. Speaker. I certainly do hope that time will allow, because I have to ask a question that stems from a response from the Minister of Finance. I'm going to keep it incredibly brief because I do have many education questions that I hope that we will have an opportunity in a second round to address. Based on the Minister of Finance's previous answer regarding responsibility, it appears that he was in charge, that he admits he was in charge when the Premier is away on vacation. Does the Minister of Finance take responsibility for the inaction of government as we encountered the 4th wave?
The Honourable Minister of Finance.
Well, thank you, Mr. Speaker. I do want to again state that the Premier and Health Minister have laid out the events of August and September. Mr. Speaker, they've identified and communicated, I think, very clearly and accurately both the modeling that precipitated the decisions that were made, that decisions we took over the summer to reopen. And Mr. Speaker, also the modeling that we received in September that prompted a change in health policy. And Mr. Speaker, it required a nimbleness that was important. It required us to make some very significant, serious, or take some action, very serious action on public health measures and change our approach. And we were willing to do that as soon as the information became apparent, Mr. Speaker.
Member for Cypress Medicine Hat, followed by Drayton Valley Devon.
Thank you, Mr. Speaker. Mr. Speaker, I am wondering how this government is going to gain Albertans' trust. First, they said there'd be no vaccine passports. That's what we have. Then now they're saying the restriction exemption program, they may repeal it in the spring. Pick a day, pick a number, pick a target. These goalposts are bound to move again. And Mr. Speaker, I'm grateful to represent the people of Cypress Medicine Hat for 10 years. And I remember when the Redford government lost Albertans' trust and were polling at 18%. And now we have the Premier's UCP government at 22%. Mr. Speaker, it sure feels the same. Albertans have lost trust. Albertans have lost confidence. How is this government going to gain it back? And Mr. Speaker, I fail to see the substantial difference between mandatory vaccinations and the forced vaccinations. Coercion, economic coercion of job loss, the restriction exemption program and the problems we're hearing for frontline workers and truck drivers and the stress and the fear and the lack of trust that this government has missed from day one. And Mr. Speaker, I remember the Premier just at the very, very end of a press conference 3 or 4 weeks ago saying something like, oh yeah, we're looking at natural immunity too. And I have not heard a word since. So as in my earlier question, a test proving natural immunity coupled with a negative COVID test, why not?
The Honourable Minister of Health.
Well, thank you, Mr. Speaker. As indicated, and as the Honourable Member knows, the REP program provides choice. It is a program which allows proof of vaccination. But it's also a program which also allows for those who aren't vaccinated, and perhaps they have some concerns, Mr. Speaker, and they're not ready yet to get vaccinated. And I understand, Mr. Speaker, that people who have concerns about vaccination, that fear is very real, and we have to understand that. We have to acknowledge that. But at the same time, then provide information in regards to vaccine about how that it can protect them and how it can protect our healthcare system. But, Mr. Speaker, the REP program allows individuals to access non-essential services by getting a test, Mr. Speaker, so they don't have to get vaccinated. And, Mr. Speaker, we put that in place to ensure that there was choice associated with that in terms of the REP. And Mr. Speaker, the honourable member is quite right. The Premier at one point in time looked at, should we assess other methods to be able to have individuals to access the REP. So, Mr. Speaker, we put our program in place in September, recognizing the incredibly high increasing of cases and increasing in hospitalizations, and we needed to move quickly, Mr. Speaker, to be able to get those numbers down. Fortunately, those numbers are coming down, and I can tell this House and through you to members of to the honourable member that as we move forward, we are going to be looking at the lessons learned through the fourth wave, and we'll look also at how we set up our program so we can maintain our principles in terms of having the least amount of impact on people while still protecting Albertans in the healthcare system.
The honourable member for Lac St. Anne Parkland, followed by Edmonton Glenora.
Thank you, Mr. Speaker, and I'd like to thank my colleague from Drayton Valley Devon. We're trying to coordinate our time here. Really appreciate it for ceding that to me so we could ask some joint questions. And I'll make sure I rattle off as many as we can just to be expedient. To the Minister of Education, we've heard concerns about masks with little kids riding on buses. Dr. Suma down in southern Alberta, her little boy, had a real major incident, and that should be a warning sign to us all. Second one is, Speaker, to the Minister, through you to her, also on the mandatory vaccinations. A lot of concerns and parents in our area when we start this signaling or talking about kids and mandatory vaccinations in schools. I want to make sure that we understand that that wouldn't be a policy that would be put in place. There's a lot of grave concerns there. Minister of Finance, we're talking about the economic recovery. Billions of dollars seems to roll off people's tongues here when we talk about health care. To put it in context, $21.9 billion is what our national defense program is. We spend $23 billion a year on AHS, plus the 1.25 contingency, plus the 2.1 billion. So the Minister of Finance, are we getting our bang for the buck for that? I'd really like to know. The other part comes down to on the global economic recovery, we have supply chains that are backed up all over the place. Long Beach, you've got Port of Los Angeles, we're missing sea containers coming into our ports. If we didn't keep the lines open, the border crossings, we literally starve within a week in this province, in the country, because of our trading relationships. We've got tons of impacts that are taking place out there, both on the economic recovery because we don't have the resources. We have a labor shortage, and we've got supply chain issues that are going to be driving up cost of service, getting our products to market, getting fair value for it, plus inflation. So although we've got a really upside, I'd like to hear what the Minister is working on those files so we can hopefully lessen the impact and maximize the growth in the province. Thank you.
The Honourable Minister of Education is rising.
Thank you, Mr. Speaker, and I think we'll tag team this one. At least I'll answer the beginning ones. So thank you for the question on the masks, and I was distressed to hear what happened to that young child, and totally understand the concern that parents have. Of course, we are following the advice of the Chief Medical Officer of Health. The instruction to have students on school buses masked in all grades simply is to deal with the spread, the possible spread, given that there are students coming from various locations that get onto school buses. It's a little different than trying to cohort a group of students in a classroom. That being said, I know the Chief Medical Officer of Health continues to monitor it very, very closely. In the summer, she was the one that recommended that we do not have masking for all students. So we started the year with no masking as the requirement, and as things changed and the pandemic went from what was perceived to be an endemic back to a state of crisis, then we had to change along with that. And so right now, masking is required in grades 4 to 12 and all staff members, as well as on buses. But we will certainly take that back to the Chief Medical Officer of Health to review, to see if there's any further recommendations that she would make in that regard. In terms of mandatory vaccinations in schools for students, I can assure you that, that students cannot be denied access to education through all grades in K to 12, and that it is the right of students to be able to attend school and ensure that they get an education. So we have no intention to bring forward mandatory.
The Honourable Member for Edmonton Glenora.
Thank you very much, Mr. Speaker. We all know that August is a very busy time for anyone who works in education. Watching my parents as teachers and a principal prepare for back to school, it was certainly one of the most intense periods in preparation for back to school. And we didn't see the Minister of Education or the Premier answer questions of the public while we were already seeing signs that the fourth wave was well upon us. We saw fourth wave numbers much higher than they were when kids went back to school the September prior. And yet the minister says that there were no recommendations around increased measures to protect students, staff, or families. We saw schools where parents had kept their children home for a year and a half, sent them back to school, and within the first 2 weeks, their child contracted COVID, brought it home, and of course the consequences in that household and the broader community were significant. So we've asked many times for the minister to bring to this House the actual numbers of students and staff members in schools who've been infected with COVID-19 during the fourth wave. I ask again tonight if the minister will present those numbers in this place either tonight or later this week through tablings. That's certainly welcome. I don't expect that she will have every number at her fingertips, but I expect that this is one that she's getting briefed on very regularly. I know that in my time as minister, there were certain things that I asked for daily or weekly updates on, and I expect that this is one that the minister is asking for. I want to know specifically as well, by a variety of schools, how many children did have COVID-19 in their school during this fourth wave period. So for example, West Glen School, many of the parents, it's in my writing, many of the parents reached out to me and have disclosed that over 80 students in that school had COVID-19 during the fourth wave, during this last little portion of time. I'm hoping for confirmation because it isn't fair to rely on parents to have to disclose this information to one another and to their MLA for us to have a clear picture. Will the minister do so?
The Honourable the Minister of Education.
Well, thank you, Mr. Speaker, and thank you to the member opposite for the question. What I can say is that we had provided school authorities early on, towards the end of June, the return to school plans so that they could, in fact, make sure that they were ready for the upcoming school year. At that time, we also indicated to them that mid-August, we would further supply health guidelines and additional measures, which we did. I believe it was August 14th that the Chief Medical Officer of Health and myself made an announcement giving them those details, again, predicated on the advice that we got from the Chief Medical Officer of Health. At that time, it was on the Chief Medical Officers of Health guidance that we, as we were by her terminology, an endemic, that we would look at recording numbers differently, that school authorities would, in fact, not be so focused on individual cases of COVID, but on all respiratory illnesses. And as such, I know the member opposite just recently had privilege to get a AHS document, and she's well aware that, the member opposite is aware that mistakes can be made, that those documents can be misinterpreted. As such, that document was misinterpreted by the member opposite when a school was listed as having a number of cases, and I'll just pick one of the top schools, the Bentley School. The member opposite indicated that there were 65 cases of COVID, when in fact there were only 9 cases. There were other examples.
Honourable members, there are 2 minutes remaining. If it's reasonable, I might suggest to the Honourable Member for Edmonton Glenora, if she wants to allow the Minister 1 minute I'll provide her a notice at 1 minute of when that time is coming to an end.
Seems fair, Mr. Speaker. Thank you very much. I have to say that I'm not asking the minister to elaborate on these other numbers that she keeps referring to. I'm just asking for the actual hard number of how many kids in each school have had COVID. So I'm glad she's got the Bentley number, have had COVID during the fourth wave. I would love, through you, Mr. Speaker, for the minister to table in this House the number of students and the schools with COVID, either by COVID OG or COVID variant, which I think those documents often refer to. I think that information would be helpful to parents and would have them have a greater understanding. Again, I'll state that West Glen School, over 80 parents have self-identified COVID in that one school here in Edmonton to the minister. So, of course, there are many other questions that parents have regarding that. Another question I would have is around, the Premier says he was in regular constant contact. When did the minister brief the Premier during his vacation about the increased incidence of COVID-19 and her concerns for back to school, given the numbers were so much higher in the community than they were the previous summer? Thank you.
The Minister of Education, there's 1 minute remaining.
Thank you, and I'm sure the member opposites would be quite happy to hear that the cases in schools are significantly less than even a few days ago. On October 29th, we had 225 schools that were on 2 to 4 alerts. Today, we have 161. On October 29th, we had 39 schools that had 5 to 9 alerts. Today, we have 25. And on October 29th, we had 5 schools that were on outbreaks of 10 plus. Today, we only have 3. So the number continues to decrease. It's similar to what we saw, the pattern we saw last year, through the last school year, where what was reflected out in the community, the COVID cases in the community, were reflected in our schools. So I'm very happy to say less than 1% of students have COVID in our schools.
Honourable members, this concludes the time allotted for that section of debate. Member of Executive Council, if they would like to make an additional statement related to COVID. I have on my list the Honourable Minister of Jobs, the Economy and Innovation, if he's still inclined to do so.
Thank you, Mr. Speaker, and I'm quite looking forward to the Q&A session that we're going to get into here momentarily. When I started this role in the summer of 2020, late August, there was an immense amount of uncertainty at that time. We didn't know if the vaccines were going to work. We just experienced negative oil prices. There was a massive global economic recession. Alberta was impacted significantly. We had approximately 300,000 Albertans lose their job. So when we took a look at how to approach this file, there was the immediate supports that were needed to help small businesses across Alberta, and we've already had exchanges here about the 125,000 small businesses that were helped with the relaunch grant. We had many deferrals. We dealt with them with workers' compensation fees to make sure that our businesses could withstand the pressure of COVID and the health restrictions that were brought in. But when we take a look at where we are today from where we started, at least when I came into the role in the summer, we take a look at where we are right now with what I call our traditional economy. We take a look at energy, agriculture, forestry, and the fact that every single one of those industries is in a very good position right now for future growth. We've got WTI at $85, natural gas prices hovering around $5. So significantly changed the financial picture as well for the province, with our budget deficit this year going from $18 billion down to about $8 billion range. So significant swing on the traditional economy of Alberta. But we've also seen significant growth in the diversification of Alberta's economy. And a lot of this as well is in our strength in energy, all things energy. When it comes to the cutting edge projects that have been announced already in hydrogen with Air Products, you have ATCO and Suncor partnering together as well on carbon capture, leveraging that technology in the hydrogen process to make sure we have clean hydrogen for the future. And these are not insignificant projects. We haven't even seen the jobs materialize from these projects yet. We've already recovered all of the jobs that were lost during the pandemic. 60,000 jobs in the last 3 months alone. There's other exciting projects, and a lot of this is policy-driven, Mr. Speaker. The petrochemical investment that was announced by Dow Chemicals, of the potential project for here, cutting edge, first of its kind in the world, right here in Alberta, leveraging technologies developed in Alberta, leveraging the policy framework that this government has put in place to attract a multi-billion dollar project to develop petrochemicals right here in our home. We also saw the announcement today with the Emissions Reductions Alberta and the leveraging of the TIER Fund to be a cutting edge when it comes to hydrogen fuel for rail, when it comes to water purification, technologies, carbon capture, all the different parts that go into that, Mr. Speaker. Not even leaving the topic of energy and mines and minerals, we also have put in place a geothermal regime where you have a leading company here in Alberta, with funding raised from some of the largest energy companies in the world ever. So, Mr. Speaker, that's happening because of the efforts taken by this government to put in place the right policies. We also have companies like E3 Metals that are taking lithium right out of active wells right here in Alberta to try and meet the demand of battery-powered vehicles, battery-powered almost everything that they're trying to turn into battery-powered these days. And that's happening right here in Alberta. In our mines and minerals strategy and with the investments we're making in research and development through Alberta Innovates, looking at our bitumen beyond combustion program, looking at carbon fiber, the other minerals that are here in our province, Mr. Speaker, there's amazing opportunity for Alberta to continue to lead when it comes to all things energy, Mr. Speaker, not just when it comes to conventional drivers, but all things energy. And the policies that this government are putting in place are winning, Mr. Speaker, and they're attracting significant investment. We take a look at diversification as well. We take a look at the tech sector, Mr. Speaker, and we've seen record growth in our tech sector here in Alberta. And when you take a look at where we were in the last year of the previous government in 2018, they had 1,200 tech companies in Alberta. They had $100 million of venture capital in the last year of the previous government, Mr. Speaker. Fast forward to 2020, over 3,000 tech companies in Alberta, $455 million of venture capital investment, a record year for venture capital in Alberta, over 4 times the last year of the previous government in venture capital, Mr. Speaker, and more than double the number of technology companies in our province. And that's not by chance as well. We've put $175 million of additional funding into the Alberta Enterprise Corporation, which is a fund-to-fund to attract venture capital into our province. We put in place the Innovation Employment Grant. We've also recently invested in partnership with the City of Edmonton and OSIF out of the City of Calgary to attract major accelerators, Mr. Speaker, that brings venture capital into the tech companies here, as well as providing customers for the companies that go through their programs. We've got Plug and Play, 500 startups, world-leading brands with their Canadian headquarters here in Alberta. We've also been able to attract emphasis, major international technology companies, Mr. Speaker. And our Premier hinted there's more to come here in the near term, Mr. Speaker, some very exciting announcements coming for the province of Alberta. We've also seen RBC announce its innovation hub in the city of Calgary, 300 jobs going there. We've seen Rogers announce 500, if their merger with Shaw goes ahead, 500 engineering and tech jobs in the city of Calgary. We've seen mCloud move its head office to the city of Calgary as well. So significant growth here, Mr. Speaker, in the technology center. We've seen the city of Edmonton for the first time break into the top 50 for innovative cities in North America. The city of Calgary is in the mid-20s as well. This is an exciting time to see these cities rise in the rankings quickly. No longer are we a flyover destination when it comes to innovation, Mr. Speaker. We're a fly-to destination that's attracting significant amount of investment. We've also seen, through the policy work of this government, an immense amount of growth in the film and television industry. We fixed our tax credit. We reached out to the HBOs and Netflix and Disney's, asked them for feedback. We fixed our tax credit. And right now, Mr. Speaker, we have the largest TV production in Canadian history being filmed in the province of Alberta. It was filmed right here in the legislature, Mr. Speaker. It's been in towns from Fort Macleod. It's been in Calgary. It's been in High River. It's going to be in the mountains later on this winter, Mr. Speaker. It's exciting to see that huge project employing thousands of Albertans happening right here because of the policy work that was done by this government to engage with industry and bring those investments right here at home. So I'll be very brief here, Mr. Speaker, in summing up. Alberta has been through a lot in the last 2 years, just like everybody else in the world during this pandemic. We lost over 300,000 jobs, but the good news is that we've recovered every single job that was lost during this pandemic, Mr. Speaker. That's something to build on. We still have a lot of work to do. We're encouraged by what we're seeing. Who would have thought a year and a half ago that we'd be talking about labor shortages in industries from hospitality, restaurants, construction, oilfield services, Mr. Speaker. We're working right now as well diligently with our Minister of Labour through our Jobs Now program, the $370 million program there, as well as our Advanced Education Minister on this 2030 strategy as it relates to micro-credentialing, when it relates to the trades. We're going to be working with the Minister of Finance as well going forward and making sure that we have that right strategy in place for the labour force of today and tomorrow to make sure that we can have those jobs filled by Albertans. Lastly, Mr. Speaker, Alberta's rebound is real. We've gone through this immense amount of work on our recovery, Mr. Speaker, and very soon, every Albertan in every corner of this province is going to start to feel this economic recovery. We're going to start to be talking more and more about future growth for the province of Alberta.
Honourable members, for a period of not exceeding 15 minutes, non-members of Executive Council may ask questions. Questions are not to exceed 2 minutes, nor are answers. Any member of Executive Council can provide an answer. The list as I have it is the Honourable Member for Edmonton Northwest, followed by Drayton Valley Devon, followed by Cypress Medicine Hat.
Well, thank you, Mr. Speaker. And my questions are directed around the vaccine passport program, of which this minister was directly responsible, and we had significant problems in the past, in the present, and seemingly in the future as well. And I would like to know why and how is it that Alberta managed to not get a QR code before all of these other provinces? And so, you know, I was given my people in other provinces sending me an example of these QR codes in Manitoba and in Quebec and Ontario and BC, and it was simple. And it really helped for businesses to be able to reopen in each of those provinces. What happened here in Alberta is we had an embarrassing stumble where, you know, we had these pieces of paper. I still have mine glued to the back of my phone, right? Which, you know, in any other jurisdiction or any other place would not be worth the paper that it's printed on, quite frankly. And so we saw the Calgary Chamber of Commerce, we saw literally thousands of people across the province asking for a coherent vaccine passport system. I'm curious to know, when did this minister get briefed on the utility of having a passport system? When was he working through this? And why did it take so long in this province to have a coherent vaccine passport system into place? I would like to know when he was first briefed and when he first realized that it was beneficial, if he realized that, of course, the restriction exemption program is, in fact, a vaccine passport. And if we would have done it in a coherent manner from the beginning, why did we wait so long to get a QR code, which is still stumbling along here in the province as we speak?
Just for the benefit of members, this period of debate will conclude at 10:30. The Honourable Minister of Jobs, Economy and Innovation.
Thank you, Mr. Speaker. And I don't want to interject too much in a kind of a tit-for-tat with the member opposite on this, but a lot of his questions that he asked are actually more on the health-related file when it comes to putting in place the QR codes and everything else. But I can answer at least some elements of the question as it relates to my ministry, Mr. Speaker. Obviously, we've been following business trends around the world, you know, how different restrictions have been put in place throughout this, pandemic, in collaboration primarily with the health department, Mr. Speaker. We did have business groups like the Chamber that were mentioned advocating for different policies. They referred to it as the vaccine passport. Ultimately, Alberta put in place the restriction exemption program, Mr. Speaker. And on that front, I want to thank all of the small businesses, the chambers, the business groups that we've met with, the advocacy groups from across Alberta as well that we've met with on a weekly basis over the last 2 months, now that we have this restriction exemption program in place, or a month and a half that we have this in place. Mr. Speaker, I just want to say thank you to them. We've gone through this perfect example to try and troubleshoot issues, get clarity, and work with the health department. I want to thank people that are working there in the health department, Dr. Hinshaw and her team, to provide clarity to those industry groups. One perfect example of that would be when we put this in place right out of the gate, would be food courts that were in a mall setting. Making sure that we were able to have a proof of vaccination program there for them. We solved that challenge within 24 to 48 hours. There's been many other nuances that we've been working through with industry in real time to make sure that, while restrictions are needed right now in Alberta due to the case count and the Delta variant in particular, that we did it in a way that could allow businesses to be as effective as possible in light of that environment, Mr. Speaker. I know it's challenging. It's a challenging time as well, with lots of people have different policy suggestions on it, but we're trying to do this in a way that allows businesses to operate in these difficult health environments.
Member for Drayton Valley Devon.
Thank you, Mr. Speaker. I have two questions that I would like to get addressed, first by the Minister of Education and then from the Minister of Jobs, Economy and Innovation. The first one to the Minister of Education would simply be this. I really appreciate the fact that you say that children have a right to an education, and I think we would all agree with that in this House. But I have the question I have is this. it revolves around parental consent. When it comes to the administration of vaccines through schools or a rapid test, will parents have to have and provide their consent for that to occur? Secondly, for the Minister of Jobs, Economy and Innovation, we spent a lot of money on helping workers and businesses survive the COVID pandemic. And I guess the question I've got is this. I know that we've got lots of workers that could lose their jobs as a result of, and really the cost of their conscience. And so the question I've got is this. Is the government or this minister prepared to support a policy that would subsidize the cost of rapid testing for workers so that they can afford to keep both their jobs and their conscience? Thank you.
The Honourable the Minister of Education has risen.
Great question, and yes, absolutely. For any student to be vaccinated in one of the school immunization programs, they have to have parental consent, as well as rapid tests. Any medical procedure, etc., has to have parental consent. That is non-negotiable in our schools.
The Honourable Member for Cypress Medicine Hat.
Thank you, Mr. Speaker. To the Minister of Jobs, Economy and Innovation to start with, please. That was a lot of information, but Minister, I've seen a different world, and I don't know if it's rural Alberta versus urban Alberta, or if it's big business versus small business. I was going around the province quite a bit in the effort to help get a strong yes vote to end equalization. Minister, there's empty buildings everywhere. There's businesses at low capacity. Medicine Hat just lost another couple of restaurants and other businesses. Downtown Medicine Hat there's a lot of despair, and it brings me back to the Premier's apology a year and a half or so ago, when he said he got it wrong using the criteria of essential versus non-essential, and it should have instead been safe versus non-safe. Small business workers that were doing everything to protect their employees and protect their customers were forced to close, were forced to have lower capacity. And then the CFIB comes out and says these businesses have taken on the average, $200,000 worth of income, or $200,000, worth of debt. An apology is great, but it doesn't pay the bills. What are we going to do to give these people hope? I've suggested we eliminate the 2% small provincial business tax for these people. Let's give them some hope. And my goodness, Minister, Medicine Hat, like so much of Alberta, the mental health crisis it's so despairing. It's through the roof, and I'm fearful that as this government can't get its goalposts correct, its direction correct, that it's only going to magnify. And Minister, and to the Minister of Education, I'm also so worried about the mental health for our kids. What we've done on this yo-yo for 2 years is frightening. So small businesses had huge hardship. Our hardworking men and women have had hardship, and our youth. What are we going to do about it?
The Honourable the Minister of Jobs, the Economy and Innovation.
And I want to thank the member opposite for the thoughtful question on this topic area. And when it comes to small businesses across Alberta, the impact of COVID, a lot of the time, also depended on the type of industry that they were in. We've seen this in the tourism industry that has been impacted quite a bit, as well as the aviation sector, and people that rely on people flying into Alberta for their livelihoods, for hosting people or people that are in that service industry. But we've also seen small businesses across Alberta, again, that have struggled through this pandemic, Mr. Speaker. There's no question about that. We've tried to do everything that we possibly could to provide them with supports. We've got over $700 million through the relaunch grant. We've had numerous deferrals, supports. We accelerated the job creation tax cut to stimulate further growth in Alberta. And the one thing I just express to those small business owners is actually an immense amount of gratitude for the sacrifices that they've made for all of our health throughout this pandemic. It's challenging. The mental health issues that you've raised, I mean, that's one of the reasons why we put $50 million into mental health right out of the gate in this pandemic, to make sure that we could be there to support people. The one thing as well that I just would hope that the people see right now is we start to see the job recovery happen in Alberta. We've recovered all the jobs that have been lost. And as we're starting to move towards growth, every forecast that's out there is forecasting Alberta's going to lead this year, next year, in all of Canada, job creation as well, and we're starting to see that tangibly happen in the last 3 months in particular, is that turnaround in Alberta, the rebound for our province is tangible. You're starting to see it in more and more announcements on a daily basis. And for all those small businesses that have out there that have survived through this pandemic, they're going to start to see more and more of their local customers have strong employment. They're going to start to see that happen in their economy. They're starting to see as well, for those that rely on natural gas prices and oil prices, that's been strong. We're going to start to see more and more investment in those industries as well across Alberta.
The honourable member for Edmonton Northwest has the call.
Well, thank you, Mr. Speaker. And again, I want to address the impacts of this UCP government and poor decision-making, always acting last, always acting least, in regards to small businesses. And, when they started with this exemption program, the restriction exemption program, I could see exactly what they were doing. They were trying to deflect the decision that should have come from the province, that should have come from the top, and putting it onto the responsibility of each individual place to choose to have the vaccine passport system. And so you went into some businesses and it was there, other businesses it wasn't there. It created a tremendous amount of resentment, Mr. Speaker, so that businesses actually lost customers. And so I asked to the Jobs Minister again, why did he fail to show leadership to make sure that we had strong restrictions in place and then move to the vaccine passport system? Small businesses put in good money, restaurants especially, on places like patios and so forth, and they said, we're open for good and we're open forever. People investing $50,000 or more on a patio and then having these things closed down a few days later. It was a yo-yo roller coaster of a ride that cost us literally thousands of businesses across Edmonton and Calgary and Medicine Hat and all places in between. And so I'm asking the minister, I'm imploring him to show leadership. We don't know what the next steps along the way is, right? Do not fall into that same trap in saying that open for summer, open for good or whatever, and then just having to pull those things back again. Every time you do that, you lose businesses. Every time you do that, our economy suffers. And quite frankly, I'm frustrated for businesses in my constituency, but I'm frustrated for small business owners all across this province.
The Honourable Minister of Jobs, the Economy and Innovation.
Mr. Speaker, and I'll provide some context here as well. I represent a Calgary constituency that's urban, big city in Calgary. We've got big city in Edmonton. And sometimes when I talk to the business community there, small businesses there, they were advocating, in the weeks leading up to the REP program coming into place, they were advocating hard. And it was through the engagement and talking with many of my colleagues in rural parts of Alberta where, some of those communities had 20 and 30% vaccination rates, whereas the city of Calgary at that point in time was around 85%. So when we took a look at policy levers that were available to us to address the immediate issue in front of us, which was the pressure on the health system, we came with the restriction exemption program as that balance to allow businesses, depending on where they were in Alberta, the best option for them to allow them to have the ability to continue on. We didn't want to come in with a blunt instrument, Mr. Speaker, that may not be operable in certain communities, given potentially at that point in time where the vaccination rates were versus where they are now today. And fortunately, the REP program has been effective. We've seen cases come down. We have seen vaccination rates go up. But then we've also seen the worst case scenario that we were worried and concerned about at the time was avoided. So, to that effect, I just want to say thank you to the feedback and patience of colleagues on both sides of this debate that, some were adamantly opposed to putting these things in place, but their feedback helped us get to the right balance in a program that works for Alberta, that works for our big cities as well as working for our smaller cities. I know it's still challenging in a pandemic, but we've also given certainty going forward that this is going to be in place until the first quarter of next year to let those businesses know what that framework is going to be. Doesn't mean we can't improve it and try and find tweaks, but at least they know it's going to be in place.
Honourable members, there is 2 minutes remaining. I might just suggest, of course it's not a requirement, but if you provide the minister a little bit of an opportunity, the Honourable Member for Edmonton Northwest.
Yes, of course, Mr. Speaker. And we all know, and we come loop back to the same thing, that is that the best tool we have to fight COVID, to get back on track, is through vaccinations. But the second best tool that we have, and we can see it through jurisdictions around the world, is a coherent vaccination passport system. And I implore Mr. Speaker, through you, to the Jobs Minister to continue to work with that and work at the very highest level. Because, Mr. Speaker, the best thing that we can do here is to provide direction through this House and to provide leadership through this House. And so I would venture to say that one of the very most strong messages that we can send is to have a vaccine passport system right here on the floor of this chamber of this House. That's a way to set an example by which the rest of the province can follow so we can get past this COVID.
Honourable Minister of Jobs, the Economy and Innovation.
Thank you, Mr. Speaker. I'd largely refer the member to my earlier commentary reflecting how we came to the decision around the REP program and the effectiveness of this program, Mr. Speaker. It has largely been adopted across this province, and businesses can make their decision largely depending on what region they're in and what's effective for their type of business, Mr. Speaker. One other point that I just wanted to raise, I know we're short on time, is that we're going to continue to make sure we improve programs. So we've done that in real time, giving people clarity throughout. We are going to do, in working in collaboration with health, we're going to do a regular review of this to make sure that we have the right framework in place. It is going to be here through, into early next year. So we want to make sure that we improve it, have it ready. We know as well, if we've heard from small businesses that we're heading into, the holiday season and Christmas shopping and things like that. So we've heard feedback around retail and other things. So hopefully we'll continue to improve this program going forward.
Honourable members, that concludes the time allotted for this section of debate. We will proceed, as you know, again to another 10-minute period where a member, well, I think you all have a pretty good grasp of how the hullabaloo works here. It seems to me that the Honourable Minister of Indigenous Relations was rising.
Well, thank you, Mr. Speaker, and good evening. And it's a privilege to join in today's emergency debate on COVID-19 and to speak on the ongoing work Alberta's government has been doing with the Indigenous communities in this province. I also want to touch on some of the work that we've done to reach Indigenous people off reserve and off settlement. This can be very complex and it needs to be a team approach. More than anything, the work Alberta's government has done during the last 20 months recognizes there are unique needs between First Nations and Métis, between Indigenous people who live in rural and those that live in urban centres, and the roles of the various jurisdictions. Before I get too far into the discussion about the collaborative work Alberta has done to help keep people safe, it may be beneficial to explain how government work may overlap and how that takes extra effort to be sure people have the information they need to make good choices. While I know some members may be up to speed on this facet, others may not be, so please indulge me. First Nation and Métis settlement governments lead the public health emergencies and communications in their communities. They work with a variety of governments for program and service support. Like Indigenous Service Canada, which includes FNIP, or the First Nations Inuit Health Branch. This is the organization that provides health resources for First Nations. The treaty relationship with First Nations is with the Crown, or as we say now, the Government of Canada. Because the Government of Alberta also provides services for people in Alberta, Indigenous people are also eligible. Likewise, municipal governments provide services that include the Indigenous people who live in rural and urban municipalities throughout the province. Other organizations like friendship centers, treaty organizations, tribal councils, Métis Nation of Alberta, and the Métis Settlements General Council have all been working to connect Indigenous people with the services that they need. So as you can see, there are many tentacles, so no one falls through the cracks, but sometimes too many chefs in the kitchens, as they say, can affect the bottom line. We all need to work together to be sure that people who need the information, the resources, and the help can get it. Every loss is a tragedy for their loved ones and those who must keep going. It's also hard on the community at large, which loses talent and expertise. For Indigenous organizations and communities, COVID-19 has been especially hard. Sadly, the Indigenous people in Alberta bore the brunt of the COVID deaths and hospitalizations. The reasons for this are complex, historical, cultural, and institutional in nature, and we must do better by them. We're talking about communities that have frequently lacked the same economic opportunities as the rest of Alberta, so the extra hit from COVID-19 has been especially tough. I've been talking with Indigenous leaders about this since early in the pandemic, and the worry sits on their shoulders, Mr. Speaker. This summer, I talked with leaders and community members. and they've had to close or restrict tourism destinations, slow down natural resource development, and watch their businesses fight for survival. One hit that has affected all First Nations comes through the First Nations casinos. Revenue from Alberta's government-owned slot machines in those casinos is redirected to all participating First Nations through the First Nations Development Fund. We call it the FNDF. Less capital available through the FNDF cuts funding for on-reserve social and economic programs that people need. Complying with the health orders by closing casinos was the right thing to do to curb the spread of COVID-19, but we see there are also economic consequences. For participating First Nations, one consequence looks like $55 million fewer dollars projected to reach them through the FNDF this year. The Alberta Liquor and Cannabis Commission expects gaming revenue to increase in the coming years. But for now, that's just a promise of better times, not a reality that people can count on. Because COVID-19 has also hurt Indigenous employment prospects, jobs numbers typically far lower for Indigenous people than the general population, call out the chronic poverty too many people live through. According to Homeward Trust, 60% of people experiencing homelessness in Edmonton right now identify as Indigenous. Only 6% of Edmonton's whole population is Indigenous. People move to the city for opportunity, not to find themselves without a home, without a community near them to help them when they need it most. Some statistics are more available than others, so my focus for the next part relates specifically to First Nations. Here's where the numbers hit home and are devastating to me, even think about, never mind talk about. But I must, so you have an idea of what occurred this past year and in the Indigenous communities. First Nations people have an increased risk of severe outcomes of COVID-19 due to pre-existing health conditions and socioeconomic factors, like I just talked about. COVID-19 has heightened other epidemics within the First Nation. Opioid overdose, deaths increased by 61% between 2019 through the first 6 months of 2020. There was an increase in the general population too, and that was only at 36%. Infant mortality rates are up. Chronic diseases like chronic obstructive pulmonary disease, diabetes, and heart disease are up. Communicable diseases like STIs, HIV, and hepatitis C are up. And one number is down, and that is life expectancy among First Nations people, with a gap between First Nations and the general population that increased from 7.3 years in 1999 to 16.3 in 2020. There are real serious gaps between Indigenous and other communities in Alberta. We see it, and we're working to make meaningful change. It takes governments working with each other to lead the type of meaningful change that Indigenous communities need. The federal government, for example, has contributed $25 million to help elders and vulnerable community members. This is to address food insecurity, provide educational supports to children, improve mental health and emergency response services, and boost preparedness measures to prevent the spread of COVID-19 in communities. Alberta's government is taking a broad-based approach because we know good health outcomes are tied closely to socio-economic safety. Provincial grant programs for community sports, social agencies, small businesses, cultural industries have helped to get more people back to some sort of normal. Wage subsidies included Indigenous communities, and isolation supports were open to First Nations to be sure they had a safe place to isolate, and some funds helped ease the challenge of being away from work for up to 2 weeks. Projects like the Site Rehabilitation Program, which made $100 million available only to First Nations and Métis settlements in Alberta, get Indigenous people working while managing their lands. The Aboriginal Business Investment Fund has put another $5 million back into Indigenous communities to build or complete capital projects, leading to long-term jobs on top of the construction jobs needed to create new tourism centres and spaces, greenhouses, warehouses, and other similar buildings. We've also boosted Indigenous tourism for funding over the next few years. And we have seen the Alberta Indigenous Opportunities Corporation make new financially stable projects possible for more Indigenous communities. The latest we just announced only a few weeks ago in the regional municipality of Wood Buffalo that saw 8 Indigenous communities become true partners in prosperity, and 5 of those were Métis. We've also taken action toward better health outcomes and have seen Indigenous communities rise with resilience, compassion, and foresight to care for each other. I think about the work the Siksika Health Nation has done in partnership with Calgary Friendship Centre to set up the Asuk in Nukiap, an urban Indigenous vaccination clinic. I was there, and they were literally going out on the streets, bringing people in. Launched in 2021, the partnership operates 2 clinics and 4 mobile units to keep vulnerable Blackfoot community members safe. With help from the Government of Alberta, this COVID clinic now offers influenza and pneumococcal vaccines. There are also going to be more publicly vaccine clinics available through this clinic soon. Indigenous-run clinics like this create safe spaces for people to ask questions and get some of the care they need. Asuk Inukyup has delivered 8,000 immunizations alone, while other clinics led by the Métis Nation of Alberta, Confederacy of Treaty 6 First Nations, and the Treaty 8 First Nations of Alberta have also created safe immunization spaces. Alberta's government is about to launch mobile clinics, a highly successful vaccine bus that will be available at no cost to First Nations and Métis communities. We're going to have elders on board and nurses and going door to door if we have to, Mr. Speaker. No appointments necessary, no cost for service, and no need to travel makes this option really helpful for people who have struggled to make time to get the vaccine. I'm proud we're able to add this option and take away another barrier. VaxFest 2 continue to bring vaccines to Indigenous youth by connecting with community influencers and healthy information. One's being held on the Stoney Nakoda land at the end of the summer that saw dozens of inoculations. Countering myths is one of the biggest challenges in getting people vaccinated against COVID-19. Alexis Nakota's Foundation has been a leader in getting accurate, accessible information to Indigenous people wherever they are. Starting with the Protect Our Elders campaign, Alexis used humor to remind people that it is all of us to keep older people safe. Through social media, web traditional media, and other channels, the campaign has been critical in fighting against misinformation. In conclusion, good health services have to deal with many different and connected factors that affect wellness. I am proud of the work this government has done, and even more proud of the work we have done across governments with the Indigenous communities. Alberta's government has committed from the start to be partners in prosperity with Indigenous communities. Prosperity goes far beyond dollars. Indigenous people need more access to community well-being and more chance at stability and ways to thrive. In that way, we will become partners in reconciliation. Thank you, Mr. Speaker.
Honourable member for Edmonton Rutherford.
Thank you, Mr. Speaker. I appreciate the opportunity to talk about this very important debate we're having this evening. I'd like to start by thanking the Minister for his informative speech, providing some information. And I think the point of my first question really will be about getting us back to a discussion of COVID. We heard a lot of information about economic development and other things, which I actually fully support, but it's not the focus of the conversation. And I'm much more interested in how the government is dealing with and handling issues of COVID, and not all the other things like the FNDF and other things that were talked about. So I'm hoping the Minister can respond to me. And actually, the first question I have comes not so much from me, but from members of the Northeast Tribal Council who have asked me to address a few things. Just remind people that there are 4 bands that are part of the Northeast Tribal Council: the Beaver First Nation, the Deneta First Nation, the Little Red River Cree Nation, and the Tall Cree Nation. And the concern that they would like the Minister to address was a decision, an announcement made by Dr. Hinshaw on September the 8th in her press conference about a decision that had been made to provide a masking exemption to Fort Vermilion School District. And this was of deep concern for these nations, as many of their children attend this school district. It is located, of course, in Mackenzie County, which is the region that had the second highest COVID rate in Alberta at the time. And their concern was that what they were seeing is that none of the First Nations were consulted, and they would like to know why they were not consulted in this particular case.
Of Indigenous Relations.
Well, thank you, Mr. Speaker. And I was up there this summer as well and visited all those communities you talked about, actually. And we had some really good discussions around COVID. Of course, that's the first thing that we discuss when we sit down at the table is what are your numbers, where are you at, what kind of help do you need? And then we get into the reconciliation. And we had some great discussions with them. We did talk about the masking issue there. And so we did engage with them to see what we could do. And I also get frequent calls from Chief Adam up there. Day or night, doesn't seem to matter what time. And he lets me know when there is a concern, and that was a concern that he brought forward, and I brought it forward to our Minister of Education as well, and we worked through it with them. So, Mr. Speaker, we're constantly engaging with the First Nations and the Métis communities to see what their concerns are. And I can tell you, Mr. Speaker, they've been working hard, like really hard, to keep their communities safe, Mr. Speaker. When I show up there, you've got to go through security. They ask you the COVID questions, rapid testing. They make sure that their communities are safe, Mr. Speaker, and we've been working hard with them to put all the safeguards in place that we possibly can. And I did talk a little bit about the COVID bus that we've been working on, Mr. Speaker, and I really want to thank Minister of Health for working with me on this and making that accessible to those communities. Thank you so much for that. This is going to be a great help in those communities, Mr. Speaker. Like I say, we're going to go door to door. We're taking elders with us so they can explain what the vaccine's all about. We'll have a nurse with us. We can vaccinate them right on the spot. So we're making sure that we're doing everything we can to work with those communities to keep them as safe as we possibly can, Mr. Speaker.
Just wishing to join the debate, the honourable member for Drayton Valley Devon, followed by Edmonton Rutherford again.
Thank you, Mr. Speaker. I would like to direct my questions to the Minister of Health and to perhaps the Minister of Jobs, Economy and Innovation, whichever one feels appropriate to answer. I believe that healthy people should not lose their jobs or face unreasonable restrictions due to COVID.
Agreed.
And I believe that healthy people should not be restricted from worshiping. And that's why I believe that rapid testing is truly one of the answers in the panoply of options that we have in the government. Rapid testing is the answer, in my mind, for finding an appropriate balance. And so I guess the question that I've got is this: is the government prepared to support a policy that would help workers and churches to subsidize a cost of rapid testing so that they don't have to make a choice between their conscience and their job or going to church or not? Thank you.
Thank you, Mr. Speaker, and thanks to the honourable member for the question. You know, as we've spoken in this House, Mr. Speaker, COVID represents a challenge for all governments, and it represents a challenge in terms of what policy options you put on the table. On the one hand, to be able to balance the need to protect our healthcare system and protect Albertans and protect each other, while at the same time, you know, the least amount of impact, the restrictions, whether it be on social life or whether it be on businesses, and finding that balance is extremely difficult. And Mr. Speaker, there are no right answers. There are just less bad answers as we move through this. Now, the honourable member spoke to the REP, and we were very, in terms of putting that program in, and then also in terms of the program as government taking the lead with its own employees as the employer of putting in a process where they're, in essence, a proof of vaccination or testing. And again, each employer makes their own choice because they have a responsibility under health and safety to ensure not only you can protect employees to the greatest extent possible, but also to protect those who the employees serve. Now, I do appreciate, other approaches have been taken by other jurisdictions and much greater use of rapid testing. And so, Mr. Speaker, what I say to the other member is, we are getting through this fourth wave with the REP. This is a process that is actually working, and we continue to use it. However, moving forward, can we learn from other jurisdictions in terms of rapid testing and how that could be used? Mr. Speaker, I think we can. I can say to the House one of my objectives and one of my key priorities moving forward after we get through the first wave and build capacity is to look at other measures so we can respond thoughtfully to other waves with the full knowledge of what's going on around the world.
For Edmonton Rutherford.
Thank you very much, Mr. Speaker. I'm very disappointed that the government side can't even stay with Indigenous issues for 2 minutes in this kind of important debate. Frustrated that they are forgotten so quickly. So I'd like to go back. In Lacrete, there were outbreaks in the continuing care center and in the Heimstead Seniors Lodge, and repeated complaints from all the Indigenous communities and, of course, Peavine and Métis settlement, all of which used the community, that businesses were not respecting closures, they were not respecting mask regulations, not respecting distancing. And as a result, there is deep concern that many of the cases on the First Nations in the First Nations of the North Peace Tribal Council came as a result of very lax government oversight in Lacrete. And they're very concerned that the government did little or nothing about that while these cases started to explode all over the place. I'm very concerned that the minister, sort of talks about, well, we're finally planning now, this late in the game, to maybe send up these buses. And I can't believe that those buses weren't sent up 8 months ago. Here they are this late. So far, the minister hasn't told me one specific thing they did to make things better for Indigenous people. He mentioned Chief Adam, although I must remind him he's not part of the North Peace Tribal Council. He seemed to think he was. But he mentioned Chief Adam, who on October 1st came out and said, you need to do more. Can you tell me what you did in response to Chief Adam's concerns? Can you tell me what you've done for the North Peace Tribal Council?
The Honourable the Minister of Indigenous Relations.
Fall apart here, Mr. Speaker. Thank you so much. Well, one of the first things we did for the Indigenous people was we lowered the age group for the people that had to be vaccinated, Mr. Speaker.
Here, here.
Because we knew they're a very vulnerable population, Mr. Speaker. So we put them in with the age group of the seniors who are so vulnerable. And so we worked really hard with all the First Nations communities and the Métis to make sure that the most vulnerable and the elderly got vaccinated first. And that really saved us on the first wave, Mr. Speaker. And we went right across the province and worked with, I literally was on the phone daily with every First Nation that we possibly could call, and we set up calls with Dr. Hinshaw. She did weekly calls. We set up a newsletter, weekly newsletter with all the information we could put in there so that all of the First Nation and Métis people would know what's happening. The friendship centers, we included everybody, Mr. Speaker, because it was so important to get that information out there. So that's what we really want to do, is make sure that the information's out there so that the people know what's available and where they can get personal protective equipment. And the First Nations worked really close with us, Mr. Speaker. I can even say down south.
Sent vaccines to them.
Oh, absolutely. We had them working with the communities, Mr. Speaker. They were setting up vaccine clinics and helping the outside communities. They were welcoming them in to help get other people vaccinated, because that helps protect their communities as well. So there was a lot of stuff that happened right out of the chute to help them to get that done. And like I said, we constantly, I never took a day off all summer, Mr. Speaker. We worked the province from one end to the other, north, south, east, and west, and we went to every community that we could possibly get to. I think we visited over 20 First Nation communities, 7 of the Métis settlements. We were all over the place, Mr. Speaker. And just trying to get that information, that feedback as to what they needed, because it was important to see what their communities were lacking and where we could possibly help. And all of the ministries worked so close with me, Mr. Speaker. I know one night we were up till over midnight with helping out communities there.
Honourable members, are there others? There's 3 minutes remaining. I think it might be, I guess he'll have some time to respond either way. The Honourable Member for Edmonton Rutherford.
Thank you, Mr. Speaker, and I do thank the minister for some of the specifics. I certainly want to hear about them, and I agree with the minister that the nations really have stood up and taken care of their communities. I've been in contact with many of them. The MNA, the MSGC as well have really put their resources in to ensure that the information is out in the community. And I guess I've always just wondered whether the government was helping them at all. Went to the Métis Nation of Alberta Vaccine Clinic, and it really was a Métis Nation of Alberta event that was done by them with their resources. And I left questioning where was the government here, particularly after the Premier in April blamed Indigenous communities for the spread of COVID and has still yet to apologize. Very concerned about that, but and I wish the minister would stand up and ask the Premier to make that kind of an apology. But I also have a very specific question I'm hoping the minister can get to now, and that is many of the people who live on reserve did receive vaccinations through the health centers on reserve that are run by the First Nations and Inuit Health Branch, and subsequently cannot download their vaccination records from Alberta Health because the province hasn't coordinated with the First Nations Inuit Health Branch to put the information together. And so even if they are vaccinated, very often They cannot demonstrate that they are vaccinated through the Alberta system, and as a result are still finding themselves being kept out of restaurants and movie theaters and so on. And I guess I'm just wondering if the government has done anything to coordinate for the significant group of people in the province who need to have that kind of coordination, given the two governments are involved.
The Honourable Minister of Indigenous Relations, Minister of Health, you have 1 minute remaining.
Thank you, Mr. Speaker, and I thank the honourable member for the question. I do know that staff with AHS have been working with a number of First Nations to coordinate coordinate information sharing. I have not actually, so I know that work is ongoing to be able to do that. I also know that that if there are issues associated with printing out the reports, that we have opportunities for individuals to call 811, get it sent to them, and print it out. But if there are issues specifically regarding certain First Nations and the information getting uploaded so they can print it out, I'd love to hear more directly in regards to the honourable member so we can actually address that issue. I know that there has been work that's been ongoing, but if you can identify where the areas are, I'm happy to hear it, and we'll get them addressed. Okay. Thank you.
This concludes the time allotted for this section of debate. Is there any other members of Executive Council that wish to make a statement not exceeding 10 minutes? The Honourable Minister of Community and Social Services has risen.
Thank you, Mr. Speaker, for the opportunity to share some of the great work Community and Social Services Minister has contributed to the Alberta COVID-19 responses. Mr. Speaker, I am proud to speak of the great work done by my colleagues. The former minister led to this contribution that we made. To begin with, I want to talk about the total investment of $130 million by our government to support civil society partners, shelters, and other key stakeholders to support pandemic response. And this is our demonstration of government of Alberta cares, and we care for the most vulnerable. We're taking good care for the time when the unprecedented health challenge is facing with our province. Mr. Speaker, let me take some time to go over some of the details of how the $132 million has been committed for that. On the onset of the pandemic, this is where you heard from Minister of Finance talk about we took immediate actions, established the emergency isolation center. We know from the get-go that for those who are most vulnerable, they are having multiple barriers, even greater than the general public, to ensure that they're safe. With that, we have total invested $73 million in this regard. We activated additional capacity, managing isolation care facilities, and provided shelter users with 24/7 access to critical services. In addition, we have topped up wages for client care staff with $25 million. And this time, I want to take the opportunity to thank them for providing the critical support for the most vulnerable Albertans. We have also provided $74 million in PPE products to service providers at a value of approximately $21 million to ensure not only our workers, but our most vulnerables are kept safe during the pandemic. We ensured that, at the meantime, we ensured all our regular community social services programs are maintained through online and phone services. The next part I want to highlight is when we the government of Alberta took the policy of mandatory vaccine for all government employees. We mirrored that policy, and we encourage all our stakeholders who provide critical social services for vulnerable Albertans to follow that vaccine policy to make sure their employees and clients are getting vaccinated. Taking this extra step not only help clients, staff, and all Albertans safe, but it also reduces the risk of adding additional pressure to our healthcare system. COVID-19 vaccine has been determined to be the best way to stop the spread of virus, and this is our way of government Alberta to contributing to help reinforce that message. Next, let me spend some time to share with our House the effort we've taken to step up our support for homeless shelters. Honourable members, through you, Mr. Speaker, you can all appreciate that for people who end up having no home to stay, they're one of the most highly vulnerable groups. We were very concerned about their safety right at the get-go when the COVID hit us. As I mentioned earlier, we committed $73 million to add additional support to activate increased capacity, manage isolations, care facilities, and provide shelter with 24/7 service, which before pandemic is not operated on that level. With the added support, homeless shelters funding have the resources to ensure that individuals experiencing homelessness with COVID diagnosis are supported in the community rather than more costly acute care in the healthcare system. The additional funding support has also allowed for setup for additional shelter sites to meet physical distancing requirements and ensuring shelters can meet public health requirements. Shelters also use the funding to move their support from regular day operations to 24/7 service so that most vulnerable Albertans can access not only services during the day, but throughout the night. Shelters have also been partnering with service providers to assist clients accessing other community social support services such as housing, food, and others. During the pandemic, we have assisted more than 3,400 people in this regard. Mr. Speaker, it's been my long belief that healthy families and strong communities are the building blocks of a better Alberta. This is true whether we're talking about mental health, addiction, disability, homelessness, or poverty. The work that this ministry does and its collaboration with our community partners provided the actual needed support to help our most vulnerable Albertans. With that, Mr. Speaker, I'd like to move on to share with our colleagues here the work we've done specifically for women's shelter. As the pandemic hit the globe, as every nation, every country in the world recognized that domestic violence went up, and the challenges to women leaving family violence has went significantly higher. And this is one of the reasons that our government took steps that we invested additional $5 million for emergency women's shelter to ensure safe isolation spaces for women and children experiencing family violence during the pandemic. Another part, Mr. Speaker, I would like to share was the work we've done with, in partnership with Alberta, thousands of civil societies, charitable organizations. That is work done under civil society sector. Mr. Speaker, Albertans have long enjoyed the spirit I call Alberta spirit, that when times are tough, we're together as a community, and we have enjoyed the sense of caring to each other, but also in the face of challenge, we never give in. We work together as a community, and we have a can-do attitude. Mr. Speaker, I want to acknowledge the thousands of nonprofit and faith community during COVID, how much they have contributed to helping our community members. It is because of that recognition of the civil society's strong connection, their power of influence in our community, that we partnered with them. We put aside $20 million civil society fund with the intent to leverage the community power when we have to deal with crises like pandemic. Mr. Speaker, I'm very pleased to report to the House that the first round of the funding through Civil Society Fund successfully went to 21 collaborative projects that support civil society for recovery from COVID-19 pandemic and help build the sector capacity. And I'm very pleased to share with the House that last week I launched the second round of funding for civil society grant, and this round it focused on social recovery through community-led mental health support services, and also the broader employment initiative that not only helping women to recover from the pandemic, but also the broader sector in terms of people with disability and other barriers. Mr. Speaker, to conclude, our government has demonstrated high commitment in helping most vulnerable Albertans during the pandemic. We'll continue to support those individuals, ensure that they have services they need to be successful, not only during but beyond pandemic. Together, Mr. Speaker, we can work towards building a future where all Albertans, regardless of the barriers they face, are given a fair chance to participate in their community. Thank you, Mr. Speaker.
Hear, hear.
Honourable members, 15 minutes of question and answer will now proceed. Each member has up to 2 minutes. The answer can be no longer than 2 minutes, and any member of Executive Council can answer the question. It will be the Honourable Member for Edmonton Castle Downs, followed by the Honourable Member for Grand Prairie, followed by potentially another member of the opposition, followed by a member of the Government Caucus.
Thank you, Mr. Speaker, and thank you to the Minister for your statement. I heard you mention thousands of nonprofits that have stepped up, and I would say that they absolutely have, because there was a need that this government wasn't providing. There were supports that they weren't able to access, and therefore they had to step up to serve communities. You also mentioned that you have a belief in families and communities, and I think that that's lovely, but where's the action? There needs to be actual support behind that belief, and we're simply not seeing it. You also mentioned multiple barriers that are impacting the community, and I would argue that your government has created incredible barriers for communities that have been decimated by COVID. We've seen poverty grow substantially here in the province during COVID-19. Homelessness in Edmonton has increased by 1,000 people in the last year. There's been a 30% increase in food bank usage in the past 2 years. It's clear that it's not enough. Not enough has been done to mitigate the issue. In 2020, the government provided $55 million in addition to the $198 million budget in homeless supports. The budget for 2021 was $193 million. Clearly, it's not adequate as the capacity limits for shelters and services remain. This has resulted in the closure of shelters, and municipalities have been left on their own to navigate this. Will the government provide additional funding this year as winter approaches? The other thing is that I've been in contact, as have my colleagues, with those that are accessing food banks, and I'd like to know what sort of plan is in place to address the problem with food insecurity in the province of Alberta.
The Minister of Community and Social Services has the call.
Thank you, Mr. Speaker, for the opportunity to respond. Mr. Speaker, as I stated earlier, that our government strongly committed helping the most vulnerable. Regarding to the shelter part, the honourable member raised the question about. On top of our regular committed $49 million under shelters, we have taken extra steps for emergency isolation center support. We have taken extra steps of ensuring that when vaccination is available, we have community centers available to assist the most vulnerable, including some of the ethnic communities who have difficulties to access to regular vaccination. And regarding to other items, I think the honourable member referenced about food, bank, and others. Let me assure you that I'm very proud our former Minister of Community Services took action using ministerial order and regulations to expanded FCSS funding criteria that acknowledging during such emergency crisis time, food support traditionally is not eligible for FCSS funding. In this time, we made it available, and that produced tremendous impact in the community. During the summertime, I had a chance to tour the province. Wherever I went, I heard those positive feedbacks from our community partners. So, Mr. Speaker, I'm very proud of the work we've taken so far.
Great.
Thank you, Mr. Speaker. It's a pleasure to rise with this now and discuss this. I appreciate the comments from the new Minister of Community and Social Services, and I also wanted to recognize his predecessor, the current Minister of Transportation, in her role throughout the pandemic in supporting the most vulnerable in this province. And so I had a couple of questions. I think the Minister was reading my mind. I was thinking about his visit to Grand Prairie, the great constituency of Grand Prairie, and some of the people that we met this summer, and particularly FCSS. The way that FCSS funding is so nimble and the way that it's been designed to be supportive and to provide and to fill gaps in, and some of the people that we met that were talking about the incredible work they were doing for those in the community. So I wanted to have the Minister maybe expand on some of the specific supports, why they were chosen. I heard food security was one of them, and I think the members opposite were interested in that as well. I think that's a really important topic with respect to community and social services at this time as we hopefully come to the tail end of the pandemic, but in the interim, we know that we have to support these communities. I also wanted to talk a little bit about the women's shelter in Grand Prairie, Odyssey House, and the great work that they're doing there, and some of the specific supports that the ministry has put in place to support the women who have struggled in their relationships and are getting back on their feet again. It was inspiring when you were up visiting, when the minister was up visiting, and so just wanted to give the minister an opportunity to comment on some of the specific supports with respect to the pandemic and the great work that our government is doing in partnership. Also, the way that we're partnering with civil society and the way that we've helped charities continue to fundraise and to support initiatives and also be nimble to the community needs. Thank you, Mr. Speaker.
The Minister of Community and Social Services.
Thank you, Mr. Speaker, and thank you for all the members for sharing some of the great observations and great questions. I want to acknowledge while I was visiting Grand Prairie, honorable member had taken such a great lead of touring me around with some of the very best community social services agencies in town. I was very impressed by the work they've done and listened to their feedback to our government, what we did during the pandemic and what was helpful. Let me highlight a couple of the learnings I learned from that visit, that triple visit. I think it was 2 days, 3 days. Mr. Speaker, it was very clear some of the early interventions we've invested for PVD supplies for nonprofit service providers, the extra funding given to them to increase the capacity. They can provide 24/7 support versus the previous regular one. That, I think, when we visited, I remember that was Odyssey, the women's shelter. They were wholeheartedly want to acknowledge that they really appreciate those extra added resources. It made a huge difference in their capacity to reach out to the most vulnerable in that situation. I think they are connecting to families who are fleeing from domestic violence, including having their kids with them. So that was noted. The second part, I think the honorable member mentioned about the work with our local FCSS community. I believe one of the counselors we met is also the president of Alberta Association of FCSS. Yes, indeed, it was a very great.
The honourable member for Edmonton Castle Downs, followed by the member for Camrose.
Thank you. People with disabilities have done their part to get vaccinated. Many people with disabilities and their loved ones are very concerned with the possibility of contracting COVID-19 because they are more vulnerable to the virus. Instead of responding to the calls for mandatory vaccines for PDD staff, the minister wrote a letter that agencies implement their own policies to require vaccines. Can the minister explain what the impact of that request has been in clear, tangible numbers of agencies requiring vaccines for staff? Another question is, there are many COVID-19 outbreaks in emergency shelters throughout the pandemic. Can the minister provide data about this regarding the first 4 waves and also tell the Assembly what will be done differently so this does not continue in the future? Another question, what does the government know about rates of vaccination amongst people experiencing homelessness? What will the government do to ensure that people who are not vaccinated can get one and that they know about the safety and effectiveness of the vaccines? Thank you.
The Honourable, the Minister of Community and Social Services.
Thank you, Mr. Speaker, for the opportunity to respond. I am proud to say that with the very many actions I already outlined for our government provide timely and adequate support for our most vulnerable during this time has shown significant difference. Let me speak a couple of the facts that can relate to, hopefully answer your question there. Regarding to vaccine policy, upon taking office with this new responsibility, I immediately assessed the need for how best we can work with our contracted agencies to ensure we have a maximum vaccine uptake. Upon consulting with, for instance, the Alberta Disability Association, they have over 300 member organizations. They wholeheartedly endorse the government that the policy the government of Alberta took to ask for all our employees to be fully vaccinated. We've also consulted with legal on our what's our ability to influence on that. I was advised that because they are not government Alberta employee, the contract agencies are essentially partners to us. So from that, we can encourage them to follow our policy. As a result of that, I think Minister of Health and I jointly issued a letter that encouraged all our funded agencies to follow Alberta's, government Alberta's policy for vaccine.
The member for Camrose has a question.
Well, thank you, Mr. Speaker. I was excited last week when I saw the Minister of Community and Social Services announce another round of the Civil Society Fund. As many members know, I'm always out promoting my not-for-profits throughout the Camrose constituency, and many have been struggling due to the COVID-19 pandemic. During the summer, the Minister of Community and Social Services was able to visit some of our not-profits, like the Camrose Women's Shelter, multiple FCSS groups, and even a few disability organizations. They're really looking forward to help during the pandemic. Can the Minister please update us on what measures are in place to support the recovery of the civil society sector?
Good question.
Will the Minister of Community and Social Services.
Thank you, Honourable Member. Thank you for asking this question to give me a chance to respond to what we've done for that part. But before I get into that question, answers, I also want to acknowledge Honourable Member has invited me to your constituency. I was so impressed by the community agencies that spoke highly about your leadership in the community. You've been a strong advocate for them. You brought many great questions for my ministry to pay attention to. So thank you for your leadership, for continued advocacy for your community there. Let me get back to some of the questions in terms of what we've done for civil society. As I mentioned earlier, our governments value the partnership relationship with our nonprofit sectors, recognizing their connection to the community, including some of the faith organizations, their strong roots in the community, and their ability to mobilize people in responding to crises like this. So with the Civil Society Fund, the round one, we allocated $7 million throughout the province, intended to give extra support, leveraging the nonprofit community's power in reaching out to others, from people helping people, including increasing their capacity for research, data collection, so on and forth. I am pleased that with that, we received a positive feedback for round 1. Like I mentioned today, as of last week, we launched the second round. I'm looking forward to all of you continue to encourage your committee members to participate.
Honourable members, that concludes the time allotted for this section of debate. Is there any other members of Executive Council wishing to make a statement? I see the Associate Minister for the Status of Women has risen.
I move to adjourn the special debate on COVID-19.
Heard the motion as proposed by the Associate Minister for the Status of Women. All those in favor, please say aye. Aye. Any opposed, please say no. No. In my opinion, the ayes have it. That motion is carried and so ordered, and a division has been called. Call in the members. this. Honourable members, a division has been called on a motion to adjourn, Government Motion 100. All those in favour of the motion to adjourn, please rise.
Honourable Mr. Schweitzer, Honourable Mr. Copping, Honourable Mr. Madu, Honourable Mr. Panda, Honourable Mr. Taves, Honourable Minister LaGrange, Honourable Mr. McIver, Honourable Mrs. Sawney, Honourable Mr. Wilson, Honourable Mr. Glubish, Ms. Armstrong-Homenuk, Honourable Mr. Orr, Honourable Mr. Luan, Honourable Ms. Isaac, Honourable Mr. Ellis, Mr. Rain, Mr. Nixon, Mr. Yao, Mr. Reid, Mr. Smith, Mr. Getson, Ms. Lovely, Mr. Guthrie, Mr. Sigurdsson, Mrs. Allard, Mr. Rosewell, Mr. Hanson, Mr. Singh, Mrs. Ahir.
All those opposed, please rise.
Ms. Sweet, Ms. Gray, Member Hoffman, Mr. Sabir, Mr. Egan, Ms. Ganley, Mr. Carson, Ms. Goring.
Mr. Speaker, for the motion, 29, against, 8.
The motion is carried and so ordered. The Chief Government Whip.
I move that the Assembly be adjourned until Tuesday, 10 a.m., Tuesday, November 2nd, 2021.
Having heard the motion as proposed by the Chief Government Whip for adjournment until tomorrow morning at 10 a.m. All those in favor, please say aye. Any opposed, please say no. In my opinion, the ayes have it. That motion is carried and so ordered, and the House stands adjourned until tomorrow morning at 10 a.m.